Dear LA&HA community, dear guests, dear friends, welcome to our 11th LA&HA Symposium, Aesthetic and Dermatology part. Again, LA&HA is in the online edition. We wish we could all be together in Portorož, but unfortunately we are coming to you from our wonderful LA&HA Institute in Ljubljana, Slovenia. Today we continue with the second part of LA&HA Symposium, Aesthetic and Dermatology program. We spoke to 3 groups of renowned Fotona key opinion leaders and experts. They have graciously agreed to share their experience and opinions, which will certainly be of great interest to today's worldwide audience. But first, let me invite the president of Fotona, Dr. Matjaž Lukács, to give his perspective on the role Laser and Health Academy plays as a source of continuous education.
Thank you, Masha. It is my great pleasure to welcome you to the second day of the 2021 LA&HA Symposium. Unfortunately, this year the symposium is again held online and we will not be meeting in person. However, it may be interesting to remember that Laser and Health Academy started in 2007 as an online website dedicated to educating general population of the benefits of laser medicine. LA&HA has advanced significantly since then, and today LA&HA is a global platform for continuous exchange of information among laser practitioners. This sharing of information takes place either by medical professionals publishing in LA&HA publications, such as the peer-reviewed Journal of Laser and Health Academy, attending meetings and symposiums, such as is taking place today, or by participating in hands-on training courses and webinars. The number of LA&HA certified lecturers is about 100, while there is already over 500 professionals who actively participate by contributing scientific and clinical papers for publication at LA&HA. In my opinion, a major advantage of becoming a part of global LA&HA community is constant education and learning. This does not stop by receiving an initial training at the time of laser purchase, but continues throughout the laser lifetime, allowing practitioners and their clinics to continuously advance and grow. For example, there are several new clinical notes published by LA&HA every month, providing continuous exchange of clinical experiences among practitioners on existing and also new protocols. Further, for those of you who are more research-oriented, LA&HA also provides a global platform for multi-site clinical studies. I wish you a very pleasant and worthwhile symposium, and do not miss another date. You are cordially invited to attend the LA&HA Super Symposium that is scheduled to take place in person this September in Dallas. Thank you very much for being a part of global LA&HA community.
Let me briefly explain the structure and flow of this aesthetic and dermatology part of LA&HA Symposium. First session will be dedicated to face aesthetics. The second section will cover body and hair, the third one, pigments, and the last one is free communication, where Fotona users will present their best cases and procedures. So let's start with the first part, facial aesthetic. We invited doctors from different parts of the world to join us in a Zoom discussion. They presented their approach in facial treatments with Fotona lasers, from non-invasive Fotona 4D to resurfacing, special vector lift, and intranasal innovative approach, scar treatment with Star Walker, and facial vascular treatments. Hello, everybody. The first session of this year's LA&HA Symposium, Aesthetic and Dermatology part, is dedicated to facial aesthetic. I would like to welcome Dr. Ashraf Badawi from Canada, Dr. Mark Taylor from US, Dr. Adrian Gaspar from Argentina, living in US, Dr. Gabriela Mershik from UK, Dr. Nasreen Mani from US, Dr. Natalia Shanina from Russia, Dr. Tianyan Li from China, Dr. Tatiana Salikova from Russia, and they will all present different facial treatments with Fotona lasers. Dr. Badawi and Dr. Taylor will chair today's session. So I would like to ask Dr. Badawi to open today's session with the overview lecture. Please.
Welcome, everyone. I would like to thank Fotona for arranging this virtual Laser and Health Academy meeting. And hopefully next year it's going to be on site. I have the pleasure also to co-chair the session with my dear friend, Dr. Mark Taylor, who is having vast majority of experience in using different laser types. It is a pleasure to have the opportunity to work with Fotona lasers and be able to achieve much improvement of the skin as required. We have great speakers. The topics are really very attractive. So I would like to thank LA&HA and the organizers for putting together this interesting topic, which I would definitely be benefiting from. Very interesting topics, whether the vector lift, which is a very important topic covered by our dear friend, Dr. Adrian Gaspar, all the 4D histology, evidence-based, we are starting to see that it's not just temporary effect, but the tissue is really improving. And then the intranasal procedures, the facial ablative and non-ablative procedures with Dr. Mark Taylor, and also a very interesting topic, which is the rosacea. So it's a pleasure to be among great speakers with a very nice device, and I have all the pleasure to join that meeting. Mark, would you like to?
Yes, let me do that. So yeah, this is always exciting. It's always nice to meet in person, but it's always good to have a backup with this technology. There's a lot happening. I'm still finding new ways to use the Fotona lasers for many different applications, and it'll be exciting to hear what everyone is doing in their particular country and their particular clinic and applications that they use. So I'm really looking forward to this. It's always a highlight of the year to be able to participate in the Fotona Symposia. So I look forward to it and to hearing from everyone.
Perfect. So with this, I think we are going to start the session, where I'll be starting my first the first talk of this session, which is the facial aesthetics. When we are talking about facial aesthetics and how we are utilizing the Fotona system, I think we all agree that it is very important to discuss with the patient what are their objectives, what they need to achieve, and what they expect. And it's very important to meet the expectations of the patients. And the patients, they don't know what we know. So they might be coming to request a certain service, but is this really the best, which is going to fulfill their expectations? This is what we need to discuss. So a patient like this who came to me, and she was actually requesting fillers to improve the nasolabial lines and the marionette lines. This is what was concerning her. And I can, of course, inject her with fillers, and I'm sure that she's going to get temporarily a nice result. It is not difficult to achieve that with fillers. However, from my point of view, is this going to be the optimum improvement? Is this going to be called rejuvenation? Is this going to restore the structure and the function of the skin? This is what we need to think of. And our objective should be always going towards the rejuvenation, restoration of the structure and the function of the skin. So I spoke with the patients and I told her, look, what we really need to do is the 4D. We need to tighten the skin, and tightening the skin should involve the nasolabial line and the marionette line. And that's why we need to do the intraoral tightening with the erbil. And then we need to tighten from outside. So definitely we need to do the piano. We need to stimulate the collagen. And before that or after that, we need to improve the epidermis. Now, within the platform of the SP Dynamis, we are able to achieve that. We discussed also in this patient, if we need to do the smooth eye, do we need to tighten the eye around the skin around the eye? This is a patient who is not having too much sagging or laxity around the eye. So if I did that, then this is going to increase the amount she's going to pay. And with the more money they are paying, the expectations are going to be more. So it's true that if we did smooth eye, it's going to improve the overall look of the skin, but not at this stage. Maybe it's better to reassure the patient and show her that we are able to address the problem she came with, which was the nasolabial line. And then we go for the next phase and with the other problems she's having. And this is what we did. We did improvement of the epidermis, and then we did the 4D procedure in order to tighten the skin from inside the mouth and from outside and to stimulate the collagen. And this was how the patient was looking after 3 sessions. Here, there is a very important point which I would like to stress. The patient, when she came back, she told me, I did not improve so much. I was expecting more. Why? Because this happened very gradually and very slowly. So the patient did not realize. When I put her before photo beside the after photo, then she saw the difference. So when we are doing something which is not giving dramatic or very quick improvement, the patient might skip noting. And that's why taking photographs and showing the patient the change is going to be very convincing. The patient was extremely happy with the improvement, and she referred about 5 patients to us afterwards. So in this case, we did the 4D, and this was enough. We didn't do the smooth eye, just some good skincare products. Definitely, we can add later on the smooth eye to improve the overall texture of the skin in this area, but it was not an imminent or urgent procedure at that time. This is another patient who, as we can see, not looking very happy. She is not happy with how her face is looking. She went through so many difficulties. And again, for a patient like this, besides the 4D, which is definitely required because we need to improve the nasolabial line, the marionette line, the jaw line, the 4D is definitely required. But in this case, even the smooth eye is indicated because we can see that the laxity around the eye is significant. And there is nothing in all the energy-based device field which can improve the area around the eye as much as the smooth eye can do. And this is what I'm going to be ending my lecture with at the end with a paper which was just accepted for publication. And this was how we achieved good result. We did the lip rejuvenation, we did the 4D superficial peeling of the skin with the smooth eye, and this is how the patient was looking immediately after, and we can see how much her overall look of the skin improved, and even the psychology improved. We can see, I think, very eminently. What is interesting is that when we are doing the lip rejuvenation, we are getting very nice contour of the lips in a very natural way, and this is a key. Today, many people are coming to request not to use fillers because it is not giving very natural improvement of the lips. However, with the laser, we cannot do that. We cannot overcorrect. So this is something which is very unique and very superior when it comes to the laser. This is another patient who wanted rejuvenation, who wanted to improve the texture of the skin. So we designed a good treatment plan for her, with including the 4D, with tightening of the neck, tightening of the face, with limiting the expectations. Because when the patient is in the late 60s or early 70s, we don't expect the collagen synthesis to be as effective as if the patient is younger. So we limited the expectations. We told her we are not going to do surgery. It's going to be laser. It's going to improve the skin gradually, slowly, but surely. And we started to execute the plan. And this was, we started in 2012. 3 years later, this is how she was looking. Definitely there is major improvement. I think if I ask the attendees about her age in this photo and in this photo, everyone is going to say that here she's looking maybe 7 to 10 years younger than here, but actually she is 3 years older. Here she was 68, here she's 71. And if we look at the area I treated, versus the area which was not treated, we can see the immediate improvement of the skin, partially due to the collagen shrinkage and partially due to the edema, which can subside. However, there is a permanent effect which is going to stay due to the shrinkage of the collagen. So we can see the neck in 3 years, although she is older, but her tissue and her skin is looking really much better. And this is the overall improvement of the skin. And we can see that the deep wrinkles improved significantly. The elastosis of her skin and cheek improved in 3 years. She is looking really younger. So this is what we can achieve with this technology. When we are able to tackle and target all the layers of the skin in a professional way with no or minimal downtime, this is really a key. A patient like this with dark skin, post-inflammatory hyperpigmentation, some active acne, in this case, maybe tightening is not going to help much, but when we do fracture with something for the epidermis, and in this case, the superficial peeling is not going to be the right option because it can be leading to post-inflammatory hyperpigmentation in that skin type. So in this case, I elected to use something like microdermabrasion to improve the epidermis and the fracture in order to stimulate the collagen, and this was the outcome. Very nice improvement of the texture of the skin with no downtime, with no risk of pigmentary changes or any other issues. So in this case, fracture was enough, along with improvement of the epidermis with either topical retinol or microdermabrasion or anything in our armamentarium in order to improve the epidermis. So this was the case, and within 3 sessions, one session every 3 to 4 weeks, we can really improve the texture of the skin, and this is something which we do. We learned after seeing the significant improvement of the skin that we can achieve the same with the lip rejuvenation, where I'm not doing any erbium peeling as many colleagues are doing. I'm doing just the fracture with short pulse duration, 0.6 milliseconds, 9 millimeter spot, and 15 joule per centimeter square with 5 hertz. I'm monitoring the temperature of the skin up to 43 degrees for 3 minutes. And we can see that the volume of the lip is enhanced, but more importantly, the texture of the lips is much improved. We can see it is immediate result. We do 3 sessions, 3 to 4 weeks apart, and we can get very nice improvement of the texture of the lips, very nice improvement of the contour, and we can see that all the lines, they disappear. So this is something which, from my point of view, is superior than the fillers, because the fillers cannot improve the texture. It will give volume, and in many cases, the lips are not going to be looking very natural. But with this procedure, we are able to improve the texture and the volume of the lip as long as we had lost volume. This is very reproducible. All the patients started to be aware of this, and they come even if they have a party or wedding or something, they can come in the same day, because this is immediate result. There is no downtime. There is no pain associated. We don't need anesthesia. I don't use cooling. It is just the laser with very immediate result, and it is going on. Now, another patient who had acne scars, for that patient, we are doing the fracture with piano, with superficial peeling, and I end the session with smooth skin, where we are using the smooth pulse with 3.5 or 3.75 joules with 4 or 5 passes on the area. And as we can see in 3 sessions, we can get significant improvement of the skin. There is superficial peeling, which is still pending after 48 hours after the 3rd session. But as we can see, pores improve, acne scars improve, and the patient is extremely happy with minimal or no downtime. So this is a procedure which I'm doing with the acne scar, for the acne scars, with very nice improvement. The last topic I'm going to cover is the smooth eye, and we got the acceptance of this paper about periocular rejuvenation using a unique non-ablative long pulse 2940 erbium YAG laser, where we use the smooth eye technique in order to improve the texture and tighten the skin around the eye. And the procedure is very simple. We do 3 sessions, 1 month apart, and we can see the tightness which happens to the eyelids. We can see how much of the eyelid is shown. The laxity improves significantly, and this is associated also with minimal downtime. Again, this is a patient where we can see the improvement. We can see how much of the eyelid is shown before the procedure, and this is 1 year after the third session. We followed up the patients for 1 year after the third session, and this means that the improvement is happening and is long-lasting. And this is the last case I present. When we have a platform like the Fotona SP Dynamis, we really feel like this guy, an artist, because you are able to do to the skin whatever the skin requires in a very effective way, with no complications, with no or minimal downtime. Thank you very much for your attention.
Perfect. That was a great presentation, Dr. Badawi. Then I would like to ask Dr. Mark Taylor to present his experience with Fotona facial non-ablative and ablative rejuvenation.
Okay, very good. I'm Dr. Mark Taylor. I'm in Salt Lake City at the Gateway Aesthetic Institute Laser Center, and we're going to talk today about ablative and non-ablative laser resurfacing. I always like to have this disclaimer that this shows what can be done, but it isn't a training session on how to do it. I do conduct a cosmetic surgery fellowship where we train board certified dermatologists for an entire year on how to do these treatments safely and effectively. We'll talk first about the SP Dynamis. What I like about this laser is it has 6 different modes so that we can choose a mode based on how much ablation or thermal coagulation we want to deliver to the skin. Also, the ND-AG modes, Versa, Frac 3, and Piano give us options also for how we're delivering that energy to the skin and the resulting effects. So let's talk first here about fractional and fully ablative erbium resurfacing. I kind of talk about Fotona 4 to 7D because I often combine other modes. We've talked about the intraoral smooth mode tightening. The Frac 3 I use often for telangiectasia, but also for collagen rejuvenation, like Dr. Badawi on the lips and around other areas. The piano mode tightening, full beam micro peel, but also I often use the fractional resurfacing, and often will throw in the Star Walker laser for green toning, specifically targeting pigment. So here we have an example of tightening, and there are scanners that can do this as well. And also there's a device that attaches to the handpiece that measures continuously the temperature that is displayed on the laser. Photorejuvenation, again, this can be done. This is lower energy collagen stimulation. We usually do this to tolerance so that we don't use any topical anesthetic or any cooling or anything like that, because we want to generate that heat in the skin to stimulate collagen production. Also, we use the fractional smooth mode to do some resurfacing, similar to what is done for the smooth eyes and other areas. This shows this next is a single 4D treatment on this person. I think you can appreciate the improvement in quality of the skin, the pigment, the pores, and other features. This is an older patient, also with a 4D treatment that has much improved luminescence to the skin, much more even pigmentation and vascularity to the skin as well, and also some improvement in the lower face. So one of my favorite things is to do aggressive fully ablative laser resurfacing. This shows how I like to proceed with that. With 15 pulses per second, a 5mm spot, and about 5 joules in the SP mode. And so you can do about 3 times.
Dr. Taylor, when the video is playing, we cannot hear you.
Oh, is that right? Okay. All right. Thank you. Anyway, that previous video showed full ablative resurfacing with the long pulse on the SP Dynamis erbium laser. This is another option for fractional resurfacing. I will frequently use that mode when I'm doing acne scars and targeting specific areas of wrinkles around the mouth and on the neck to enhance those in addition to the fully ablative resurfacing. This is an example also using. So there we're using the fractional resurfacing, which is something that can be used on the trunk and extremities safely to help many different conditions, crepey skin, stretch marks, and other types of conditions that we want to improve. Also, when I'm doing resurfacing, I like to clean up all of the other distractions that are on the skin. Here we're treating small keratoses, vaporizing those so that when we get done, the skin. By doing that, we're ending up with a nicer final result. Here we have sebaceous hyperplasia that I'm treating with vaporization. Again, all these things are done in one session so that when we get done, we really have clean and clear skin. Here's some seborrheic keratosis that are part of the comprehensive resurfacing. So there in that video, we're using a microsecond pulse to very cleanly and precisely remove the seborrheic keratosis. These dermatosis papulosis nigra are lesions that are classically treated this way in my clinic with the microsecond pulse and a very precise vaporization only to the DE junction. So when we combine resurfacing with piano mode tightening, we can get results like this that are quite dramatic. This is a patient that had 3 modes. She had full ablation, she had piano mode tightening, and she also had fractional resurfacing. And these were all done on the same day. And this is her 1 week after the procedure. You can see already the improvement in the quality of the skin, the tightening around the lower face and jowl area. These are other patients that we've done in a similar manner. This patient had many seborrheic keratosis that were vaporized as part of his full face laser resurfacing. This man from Australia had many actinic keratoses that we removed along with his resurfacing. This gentleman had a hemangioma on his forehead that we treated with the YAG laser during his laser resurfacing. This man had many pigmented spots, actinic keratoses, and by removing all of these in this session, full ablation plus spot resurfacing, we can get a nice improvement. And this lady as well, you can see the improvement in the tightening of her skin, the pigmentation, the wrinkles around her eyes and her face, and these are all single sessions. This is another single session with significant photo rejuvenation of the skin, pigment, wrinkles, etc. Here we combine fractional and fully ablative resurfacing and piano mode tightening. So one of my passions is acne scar resurfacing, and you've seen possibly some of my presentations in the past, but I like to do a very comprehensive treatment on one day using tumescent anesthesia, extensive subcision, blending TCA or laser peel, and then fractional ablative erbium resurfacing. This is a tool that I invented to do the subcision with. And so this is something I'm doing more commonly now. To start with, I will use the microsecond pulse and treat the borders. So we use that to smooth the borders of the scars and blend them into the normal skin. This next patient, so that is the subcision, and that is where we go underneath the skin with the tool and release all of the scar bands. Then I will do an aggressive fractional resurfacing. In this case, I'm using the Star Walker laser with the fractional 1064 treatment. And usually we'll do 6 passes. Sometimes I will stack the passes. And this helps to break up those collagen bands and normalize the surface of the skin. This is one of the patients that we did with the Star Walker and the subcision. Here's another one done with erbium resurfacing and subcision. This was erbium resurfacing and subcision. And here's another erbium resurfacing and subcision. And this on the after photo is 1 week later. So I try to do these all as a single treatment. We actually published this. It was published in Dermatologic Surgery last month on 56 patients with ethnic skin with an average improvement of 70% after one treatment. These treatments can also be used, as I mentioned, on the trunk for stretch marks. And so this is the smooth mode with the PSO3X. So that was the smooth mode with the PSO3X. This is only one treatment, but I think even with one treatment, we see significant improvement. It is possible and advisable to do multiple treatments when treating these types of lesions on the trunk. And I like to combine piano mode and the smooth mode when I'm doing this, so I get tightening in bulk tightening and also surface tightening of the skin at the same time. This can also be used on other areas such as the buttock and thighs for stretch marks and laxity of skin. Thank you very much for watching.
Thank you, Dr. Taylor. So the next speaker is Dr. Adrian Gaspar. He will present exciting new approach for non-invasive facelift called vector lift. So please, Adrian.
Okay, thank you very much. Thank you so much for this opportunity. For me, it's a real pleasure to share this new protocol we have been doing for the last, I would say, 12 months. I will share my screen. Let me see. Okay. Okay. Well, the title of my lecture is to introduce you what Fotona has called the vector lift. My name is Adrian Gaspar. I'm from Mendoza, Argentina, and I'm going to introduce this new protocol, which is the Fotona's proposal for the growing eyebrow lifting trend. It's a reality that during the whole last year, a very particular year, we have seen a strong trend in eyebrow lifting procedures. And we have considered the idea, why not start promoting or producing this tightening effect at the level of the eyebrows for these patients looking for this type of procedures. This aesthetic enhancement has gone viral through several trendsetters, such as Bella Hadid, who promoted with the name of Foxy Eyes look, or the Foxy Eyes treatment. And up to now, if we consider which options did we have to promote or to improve the appearance of the eyebrow, apart from injectables, I have a fair amount of experience using injectables, mostly Botox, for example, botulinum toxin, with acceptable results, but very transient effect. So we see currently the design of this look has been accomplished by either applying makeup or also tattoos. With makeup, it is called 3D eyebrows makeup. And also in my case, I have a good experience using different types of threads, as you see here in this picture. With PDO threads, PDO stands for polydioxanone threads. The effect is maybe between 6 to 9 months, depends on the patient and the amount of threads you have used. The recovery average is 3 days. We need special precautions like sleeping in certain position, avoid impact for the first week, and we may have side effects such as ecchymosis, swelling, pain, although there are not severe adverse effects, but we have to be careful. And this, we all know that this is the least successful facial thread protocol if you compare with other types of protocols using threads. While some patients may have good results, such as, for example, this case, or maybe this one, we can also have unwanted results. And this is the problem because this is an invasive option to have this enhancement. So Fotona's proposal for the growing eyebrow lifting trend, for this, it is called vector lift. The treatment is based on the application of smooth mode in 3 steps, combining eyebrow elevation, upper eyelid tightening, and collagen renewal on lateral forehead, scalp, and eyelid. So what we have been doing, we have been using the hyperstacking of smooth pulses because we have observed excellent results also in histologies in other body areas that we have performed. We have tested and we have confirmed that we can go deeper by doing hyperstacks, and also we can strengthen the connective, the fibrillar component of the connective structures using this. So the protocol is extended to the scalp, to the eyelid, because as this is a very short area, we need to create vectors. So we extend to the scalp to reinforce the eyebrow elevation. So the protocol starts by using, we numb the area, because when we stacks, if you want to get the crucial number of stacks, the crucial the crucial amount of heat we need to promote this initial shrinkage, we need to numb the area. So you don't need to mark the area at the beginning. Maybe it's more, it will be easier if you do with a white pencil some marks. As you see here, the white dots, for example, will mark the scalp treatment channels and are placed to create rows that are 6 millimeters apart. And if you see here, the vertical line, this one here, will determine if the patient, depends on what is the patient requests. For example, if you want only the elevation of the tail, well, the midline, this line should be placed here in the mid-pupillar line as marked in the picture. But for the full eyebrow lift, it should be moved nasally towards this area. So the first step, there are 2 different ways to perform the first step, and we have had excellent results, as you will see in the photos, using either the stamping technique or the brushing technique. The stamping technique, which is the most reproducible maneuver, you can see the parameters here that we have been using with 7 millimeter spot using smooth mode, the PSO3X. Our fluency average is between 2 to 2.25 joules, 2.25 joules per square centimeter, and we have been performing 10 stacks. Although you have in the laser up to 9 stacks, but we are using a new software that can allow us the possibility to use up to 40 stacks. The frequency is 1.6 hertz, because with this frequency we are assuring the possibility of a good, the longest pulse duration. We are simulating what we do with the scanner when we use a 6.25 millisecond smooth mode. And we do between 1 to 3 passes, depends on patient tolerance, if we get erythema, or according to the hydration of the skin, as I will show you later. So stacking a total of 10 pulses per spot has proven to be as an effective way to maximize tissue tightening and providing deeper heat penetration, which in turn produce better collagen renewal. Of course, that if you do 20 stacks, for example, you will also have good results, but it's more time consuming. And another thing that we have observed, that there is a limit of shrinkage, because we have done in other body areas, we have compared 20 stacks to 10 stacks, and we have seen not much difference, because it seems that there is a certain limitation. You cannot get more shrinkage in one session. So you cannot get more tension with the vectors in the same session. There is a threshold in which then the fibers will not continue responding. So in our experience, this is in relation with the amount of water in the tissue, because we have observed that the more hydrated the tissue, the better the tightening. This is a video showing the second way to do the step one, the brushing option. Look at the speed of my hand, my working hand. I use my one hand to stabilize the skin and the other hand to pass the laser. It's important to be careful with the speed of the brushing, because if you are too slow, you may burn. If you are too fast, you may not accumulate the proper amount of heat. And you have to do here no less than 500 pulses per area using these parameters. The maximum frequency, spot size 7 millimeter, the fluency is 6.25 joules per square centimeter. With this simple tool, which is very easy to find, we measured the level of hydration of the skin. Why? Because we wanted to see if there was any difference, because when you do hyperstacking, you need a better hydrated skin, because this is non-ablative. So if you have better hydration, you will have better tightening effect, and you will get less erythema. Using this simple tool, you can see that there are different levels of hydration, even in the same patient, in the face. While the lower third of the face may have 60–70% of hydration, the upper third, for example, may have 20 or 30. If you have less than 40, you will get for sure more erythema with hyperstacking, either hyperstacking or brushing. So increasing the hydration of the skin is a very simple task, because you can prescribe some cosmeceuticals, or you can do something with the cosmetrician to promote hydration. This is two examples. For example, in patients where the hydration was not good, the result was acceptable, but look at the erythema using hyperstacking. And then we have the second step, which is the treatment of the scalp. This is to reinforce the vectors. For this, we stacked 10 shots again, using 7 millimeter spot, and we increase the fluency from 2.5 to 3 joules, depends on patient tolerance. And we do 3 passes. We have to follow the road that we created with the dots that we marked at the beginning. So extending the treatment to the scalp provides a strong hold or anchor point in the lifting effect, thanks to the high adhesion of the superficial musculoaponeurotic system. And finally, we treat the upper eyelid. We treat the upper eyelid to improve skin laxity in this area. Pay attention to the spot size, 5 millimeter. The fluency is the same. The number of stacks is the same, 10 stacks. Remember, and we do 3 passes using the same frequency. 3 passes could be 2 or could be 1, depending on patient tolerance. Remember, you have to numb also this area because you are using hyperstack technique. Hyperstack technique will require anesthesia. So this is one example of one side treated. You see, the result can clearly be seen immediately in the majority of the patients, and after the second session in the rest of them. And this is the full face treated, the full vector lift 2 sides treated after only 1 session. This is another case, for example, where I have treated. You see that the forehead doesn't appear with erythema, because this lady has a good hydration, because she takes very good care of her skin. Other cases where only one side has been treated. So you see, the results are better, in my experience, than the ones I can get using PDO threads in combination with botulinum toxin. This is, for example, look at the quality of the skin. This is after 3 sessions, tightening and brow lift. Strengthening of the connective tissue will occur in 3 months, because it will take time. It will take time to strengthen the connective tissue. We have seen this in biopsies that we have done in the abdomen. So the total treatment time is 25 minutes, could be even less. 4 sessions, you can do 3 to 4. Normally we do 4 sessions, 1 every 3 weeks, and you can do it every month. You can also combine this with a 4D treatment or a lip-lace treatment. It's very comfortable, and we have seen no complications. And look at this. This is a great example of what we call a total transformation achieved by a combination of eyebrow vector lift and 4D. This is immediately after the 3rd session. And this is another example. This is what we have done with the Fotona 4D, vector lift, and PRP. This is after 3 sessions as well. So our protocol, patient preparation, is important to improve the hydration of the skin. When you are using the hyperstacking, it's very important to maximize the result. We always use Winamp the area. You will never use here a cooling. The total treatment time, 25 minutes, session 3 to 4, 21 days apart. And for the post-operative requirements, the skin hydration and solar protection. And thank you very much.
Thank you, Adrian, for this really exciting new approach. I would like to ask Dr. Gabriela Merschik to present her new exciting treatment, which is called intranasal treatment.
Good afternoon. I am Dr. Gabriela Mercik from London, Harley Street. I also have clinic in Poland, just opened a couple months ago. And I have fantastic news today because I use Fotona laser for something completely new. And I would like to share my knowledge and experience with all of you. It is my pleasure to show my achievements. I am using a system Fotona SP Dynamis, and I achieve very good result for the facelift, face and eye lift. And many of patients, they were asking, can I do something with nose? Because nose is aging, the same like all body. And with the disappearing fat tissue under the skin and the bone structure with the aging is changing as well, the soft tissue, they looks longer and bigger. And a lot of my patients, they were asking, can I do something for their nose? And I came with this idea to try Fotona laser to shrink the nose. I used the Fotona Smooth. It is like 6 stuck in one place. And I use PSO3 and R11. Also, we have the new handpiece from Fotona that we are experimental now using this handpiece. And I want to show you what we achieve. This is the settings. In my opinion, it's easier if you can see on the screen that what we do, we use first erbium yak, and we go by stacks inside the nasal, and I will show you in a minute which area I am stacking. And after that, I am using, on the first step was R11, and now we will have new handpiece. And with that is like more tightening. Of course, the noses, they are different, and always I am going back to the artist and ask them, can you show me the types of the noses? And some of the people, they are not happy from the born that they don't have the perfect nose. I am so surprised that by laser with no needles and with no any surgery, no any downtime, we can change the nose structure. This is anatomy of the nose, and I would like to show you just to look at this part when I am targeting. This is the part I am targeting here. I am targeting there and under the nose. This is exactly the places that I am shooting. What I want to achieve, I want to leave the tip of the nose and shrink the sizes that will be, nose will look slimmer and shorter. After that, I am going to the intraoral part and around the frenulum. I am shooting like the same we do the oral part of the lifting. On this area, I am doing like 3 stacks, 3 passes here and 3 passes here. And after that, extra part around this area. And the result, you can see what happened with the nose, that much better. This lady, straight away, we can see the difference. This is the fantastic result when we were all surprised that the nose looks like 1/3 on the start what we had before, and this is only after 3 treatments. I divide the treatments because I was playing with Fotona. I was trying to achieve the best results, and I found that the best result is after the 3 treatments. I am doing the treatment every 2 weeks, and after 3rd session, I review and I take the picture before and after, and I am showing the patient the result. They are very quickly forgetting how they look before. They are surprised, but the truth is that after the 1st session, they see the difference, and they see the how shorter is nose on the tip of the nose is lifted up, and the size, they are slimmer. You can see from diameter from side to side is much smaller after the 1st treatment, and also here. When we start to do the modeling, the nose is smaller and is shorter. This is perfect example. You can see during the treatment, this is only 1 treatment done. And with the glasses, you can exactly see how big difference between left and right picture is. This is actually my assistant, and she said that she will work for me for all her lifetime, because she didn't like her nose, and after the treatment she was so happy, and she was crying that she was thinking that she has to do surgery. But you can see the structure of the nose is much shorter and lifted up, the tip of the nose. This is my the biggest nose what I get. If we talk about how tall and long, we are during the treatment. This is after the 1st treatment, but we can see the difference on the face. The gentleman is already happy, but we have another 2 treatments in front of us. I want to show you just the difference between before and after the 1st treatment. And I hope in next year Fotona meeting, I will show you the last one, the final result. Thank you for your attention. I hope that you enjoy it, and it is something new what you can try in your practices.
Great. Thank you, Dr. Gabriela. That was quite fascinating. For several years now, Fotona 4D non-invasive rejuvenation treatment has been one of, if not the most recognizable Fotona procedure because of excellent results and minimal invasiveness. Dr. Natalia Shanina and colleagues published an article showing histological changes in the skin of patients after Fotona 4D treatment. So I would like to ask Dr. Natalia Shanina to present her study.
Здравствуйте, уважаемые коллеги! Приветствую вас из города Санкт-Петербург. Мы представляем вам доклад на тему гистологические и иммуногистохимические изменения в коже лица после процедуры Fotona 4D. Как мы знаем, кожа является отражением общего состояния здоровья человека и показателем возраста. При возрастных изменениях кожи появляется дисхромия, изменение рельефа кожи, снижается тонус и эластичность. Эти изменения являются следствием фрагментации дермального коллагенового матрикса и нарушают структуру целостности дермы и низкого уровня выработки коллагена зрелыми фибробластами. Лазерное воздействие с целью омоложения кожи на сегодня является одним из наиболее эффективных терапевтических методов. Комбинированные лазерные методики дают синергичный эффект в результате воздействия различных длин волн. Целью нашего исследования было оценить макроскопические, гистологические и иммуногистохимические изменения в коже лица при коррекции возрастных изменений под воздействием комбинированной лазерной терапии. В нашем исследовании принимали участие 14 человек, 2 мужчины и 12 женщин. Тип кожи по Фицпатрику 1, 2, 3. Пациентам выполнялись 2 процедуры с применением комбинированного лазерного воздействия интервалом в 1 месяц. Контрольными точками исследования были до курса процедур, через 1 месяц и через 2 месяца после начала терапии. В исследовании нами применялась технология неинвазивной объемной реконструкции и волюмизации кожи лица по запатентованной методике Fotona 4D. Это комплекс из 4 этапов процедур комбинированного лазерного омоложения кожи лица и шеи с эффектами фотохимического фототеплового воздействия. Методика Fotona 4D захватывает поэтапно все слои и позволяет провести неабляционную фототермическую реконструкцию кожи, вызывая термическое воздействие на коллаген и запуская процессы неоколлагенеза и ангиогенеза. На представленных фотоснимках определяются изменения в процессе лазерного воздействия. Обращает внимание выраженный положительный эффект в области носогубных складок. Сгладились морщины в области лба и переносицы, повысилась эластичность кожи. Оценка изменений проводилась по индексу оценки возрастных изменений кожи лица. В процессе лазерного воздействия данный показатель снижается, соответственно, состояние кожи пациента улучшается. На данном слайде мы видим лицо женщины и также отмечаем уменьшение глубины носогубных складок, складок марионеток, сгладились глубокие морщины в области лба и переносицы, повысилась эластичность кожи. Индекс оценки возрастных изменений кожи лица в процессе коррекции показал существенное снижение, что свидетельствует о выраженной клинической эффективности методики комбинированного лазерного омоложения. В работе у нас проводились гистологические методы исследования. И по данным биопсии кожи, во всех случаях до проведения процедуры имелись явления атрофии и низкая клеточность. В случаях после применения метода отмечалось увеличение количества и активности фибробластов, повышение плотности соединительной ткани. Также нами проводилась динамика оценки морфометрии эпидермиса. При изменении эпидермиса высоту эпителиального пласта определяли от уровня базальных клеток до нижних слоев рогового слоя. Выявлено существенное увеличение толщины эпидермиса после применения неабляционного лазерного облучения. Гистохимический метод окраски тканей по вангизону, применяемый нами, позволяет окрасить коллагеновые волокна в красный цвет. И при окраске ткани биоптата у пациентов после курса лазерного облучения отмечается более интенсивное прокрашивание и увеличение количества коллагеновых волокон. Материалы, полученные нами при гистохимическом методе окраски тканей по вангизому, были исследованы при помощи программы «Морфология 5.2», что позволило нам оценить в численном выражении увеличение коллагеновых волокон. При проведении иммуногистохимического исследования с моноклональными антителами к CD34 была отмечена повышенная экспрессия данного маркера в зонах новообразованных сосудов в препаратах после лазерного облучения. При анализе иммуногистохимической картины с использованием программы «Морфология 5.2» отмечалось статистически значимое увеличение количества коллагеновых волокон и сосудов через 2 месяца от начала коррекции. Таким образом, полученные данные показывают очевидные положительные изменения после комбинированной лазерной процедуры, которые также коррелируют с клинической картиной. Используемое комбинированное лечение эрбиумиодиновым лазерами является одним из наиболее многообещающих методов улучшения состояния возрастной кожи. Доклад окончен. Благодарю вас за внимание.
Thank you, Dr. Natalia Shanina, for this great presentation showing that the minimal invasive treatments such as Fotona 4D can really make fascinating histological changes as well. So yeah, this was very interesting. Now I'd like to present Dr. Tianyan Li, presenting a unique Fotona 4D experience in Chinese patients.
Ladies and gentlemen, my name is Tianyan Li. I'm a dermatologist. I'm the co-founder for ADD Aesthetic Medical Clinics. One is in Beijing, the others are in Shenyang. I have been using Fotona 4D for about 5 years. And I'm one of the first group doctors using Fotona 4D in China. I'm glad sharing my experience about that. You know, Fotona 4D is very popular in China. Of course, it's very popular in my clinic. And I have many patients who have been keeping accepting Fotona 4D treatment at least 2 years. And my doctors, colleagues, and I keep to improving this treatment for matching the Chinese patient goals. And the Fotona 4D have many treatment for doctors to using the standardized Fotona treatment. But in my clinic, our treatment have some difference. It is very known that there are some aesthetic difference between East and West. For Chinese people, they want clear facial contours. That means the mandibular margin line. They want to look younger. They pay more attention for upper muscle and nostril grooves. In my clinic, before treatment, accept the Fotona 4D treatment, evaluation should be done first. We assess some factors for the patient, for example, skin texture, surgeon, upper muscle, and nosocomial groove, and so on. Then we made a customer's range for them. You know, we have different hand tools for the different problems. There are some option details. We found that so quickly and pell-melling moving the hand tools was inefficient and make doctor took more time to do the treatment but got inefficient results. For facelifting, you can say we can make some high temperature in some important area. Where is that important area? For facelifting, there are some skills. We use different tools for some important facial ligaments areas, such as we can see these areas is very important. That is very important for facial lifting. Hair temperature, more times, and more layers. and the patient will feel a little pain, so we should use the cool air machine. There are some cases we can say the patient found some difference before and after. They found their face lifting and smaller just after the treatment immediately. Most found their face got smaller. For young lady, first they were satisfied their skin are shiny and tanning. For most ladies, 3 times a year is enough. For the ladies, you want to get extreme, maybe they want to get extreme. That ladies, that is a little older, 15 years old, 3 times a year. But she was very satisfied with the result. That we follow up more than 1 year, 3 times a year, Fotona 4D. And she found that she's face is forming more than 1 year ago. And for younger ladies, they want the extreme goals. They will choose combination therapy. They submerge and Fotona 4D together. Interview 6 months, follow up 1 year. That case is for our Dr. Zheng Xuemei, that's Shenyang ADD clinics. For me, it's a very special time. I wish we should have the opportunity to meet up for some future discussion face-to-face as soon as possible. I do hope that we can create miracles with our joint efforts to help more patients change their lives by building their confidence. It was such an honor meeting you all here. Thank you for your time. Thank you.
Dr. Nasreen Mani from US will speak about Starwalker MacuX and fascinating fractate acne scar treatment.
Good morning. My name is Nasreen Mani, and this is my presentation. Fractional technology for skin treatment gained its high popularity in past 10 years due to its minimal invasiveness and good efficacy when used in multiple sessions. Recently, a new type of fractional technology emerged, the fractionalization of Q-switch laser beam, with the same idea to get gentler and less invasive treatment modalities in comparison with full spot ones. Although most of the users pursuing minimal invasiveness started the use of fractional Q-switch lasers in the non-ablative mode, we decided to try it in a slightly more aggressive ablative mode. The main purpose of this study was to evaluate the safety and efficacy of fractional ablative Q-switch 1064 nanometer Nd:YAG laser for treatment of acne scars. This is a retrospective study in which patients with acne scars were treated with fractional ablative Nd:YAG Q-switch lasers in the period from February 2018 until October of 2020. The inclusion criteria were men and women above age 16 who were complaining of acne scars and looking for minimally invasive treatment, no severe underlying diseases, and willingness to follow up with the study protocol. The exclusion criteria were active or recent facial skin infection, immunocompromised status, recurrent herpes viral infection, history of skin cancer, history of photosensitivity disorder, use of photosynthesizing drugs, and pregnancy. Patients received antiviral prophylaxis acyclovir 800 milligram PO twice a day for 3 days, starting on the day of the treatment. No other pre-treatment method were used. The treatment were using 1064 nanometer Q-switch Nd:YAG laser Fotona Starwalker MacuX from Slovenia. Ablative fractional modality was used with FS20A handpiece, 9 by 9 pixels at 9 by 9 millimeter. The settings were energy level of 30 to 70 millijoule per pixel and MacuX 10 mode. Multiple passes, 2 to 6 passes over the treatment area have been performed according to the severity of the scarring. Patient received multiple treatment until satisfactory results were obtained. This is an example of a patient that is being treated using the FS20A, and this to the right is the immediate post-treatment photo. And this is a video of how I treat the patient. You can see the laser is being applied in rows, 10% overlapping, and 2 to 4 times passes in different direction. And you can see immediately to the right the post-treatment. For post-op, we use topical platelet-rich plasma to speed up and improve the healing process. Topical clindamycin for 5 days and by-mouth acyclovir 800 milligram for 3 days, twice a day. No sun exposure, and they could apply sunscreen 24 hours later. No other anti-scarring procedures were used. This is a before photo to the left, in the middle during the procedure, and to the right 2 days post-op. And again, another patient of mine before, you see during the procedure applying platelet-rich plasma, and to the right is 2 months post-treatment period. At every visit, standardized photographs were taken for evaluation of the treatment efficacy. Subjective and objective tools were used for assessment of treatment efficacy, and adverse effects were observed every day until reepithelialization were obtained. Total number of patients were 46, 37 female and 9 male. Photographic evaluation with correct identification of pre-treatment pictures were compared with post-treatment pictures performed with 3 independent reviewers. And satisfaction questionnaire were asked, and global aesthetic improvement scores were obtained. 85% of patients which responded to this questionnaire were satisfied or very satisfied with the result of the treatment. 3 independent reviewers made the blind evaluation for the treatment visible on before and after pictures using the global aesthetic improvements scores. On average, reviewers were able to correctly identify before and after pictures in 92% of the cases. 75% of the patients were improved, 25% exceptional or very much improved. Aside of expected post-operative side effect, no other adverse effects were observed. This is a before photo and 2 months after the 3 treatments. And side photo of the same patient. And this is a very happy patient 3 months post last treatment. In comparison with erbium-YAG fractionated laser treatment of acne scar, the use of ND-YAG Q-switch fractionated is offering shorter recovery times. In average, with regular erbium-YAG fractionated, the reepithelialization occurred in about 6 days and redness for a month and a half. But with Q-switch ND-YAG, the reepithelialization occurred half as much, which is 2.5 days, and redness was much shorter for 9 days. In conclusion, fractional ablative Q-switch 1064 nanometer ND-YAG laser modality is an attractive new way of treating acne scars, producing good results with minimal level of short-lasting adverse effects and high patient satisfaction. Thank you.
Our last speaker is Dr. Tatiana Salikova, the winner of Fotona Trophy 2020 contest from Russia for the best case with Fotona lasers. She will present her winning case and other successful facial treatments with Star Walker MAQ-UX.
Hello, Dear colleagues, I am pleased to present my report to your attention. About 20 years ago, laser technologies were first coming into medical practice of cosmeticians. At that time, procedures using laser equipment was something avant-garde and high-tech. Today, the use of laser technologies in cosmetology is not extraordinary. Different kinds of laser equipment are widely used, solving a lot of aesthetic problems. But it is only now becoming clear that the previous laser equipment was not perfect, while the modern lasers combined exceed all our expectations. In my opinion, such a device today is the Starwalker. The Starwalker is a laser combining photothermal and photoacoustic effects. Photoacoustic effects appeared recently, and if earlier it was more intended to remove artificial pigment, now the photoacoustic effects are used for solving different kinds of aesthetic problems. It's borne in that the pulse shortening gives less thermal action, which has many advantages. The first significant advantage is that the absence of targeted heating prevents post-inflammatory effects, which eliminate the risk of complications. On this slide, you can see the photo of a patient diagnosis with melasma before and after the laser treatment. There were 5 procedures, once per month, in combo with the local treatment. As a result of the treatment, the hyperpigmented spots were lighted. Their borders became poorly demarcated. The size of the spots has decreased. Procedures of fractional ablative laser rejuvenation cause a significant heating of tissues, which results in post-procedural edema. This is exactly why these procedures are restricted to the patients having deformated type of facial aging and facial puffiness. The same goes for the patients with rosacea. The fractional photothermolysis will provoke an increase of the vascular components. From there, fractional rejuvenation with photoacoustic mechanism of action makes sense to these patients. In this case, the heating is minimized, and as a confidence, there is no edema or vasodilatation, which eliminates the occurrence of unwanted manifestations. That is precisely what allows us to say with confidence that the procedure of the fractional rejuvenation by Starwalker is the procedure of choice for patients with capillaropathy, deformative type of facial aging, and liability to puffiness. On this slide, you can see the patient's rejuvenation by the Starwalker device. There were 3 procedures in combo with biorevitalization. As a result, depth of wrinkles and lines is decreased. Here's one more clinical case and photos of a patient with rosacea before and after the treatment with Starwalker laser. The patient had 8 procedures of laser treatment as monotherapy. After the treatment course, the result was significant. Papillopapular elements were regressed. Telangiectasia were reduced for 80%. The result was obtained with a long-lasting remission. This clinical case permits to improve that the laser treatment of rosacea by Starwalker is highly effective and can be used as monotherapy. There is no doubt that the Starwalker is using for tattoo elimination and shows its highly efficiency, quick results, and absolutely security. All these clinical practices were achieved based at our clinic Revital and showed high efficiency of star walker for the treatment of different aesthetic and dermatological problems. High efficiency of star walker both as monotherapy and in combo with other procedures. Preferred choice of star walker for treatment of some aesthetic and dermatological nosology. Star walker can be used for fractional ablative laser rejuvenation with deformative type of facial aging, liability to puffiness and capillarity. Thank you very much.
Thank you, Dr. Salikova. Yeah, this was really nice presentation of the versatility of Fotona Star Walker laser and great cases. So now, thank you all the speakers. We are closing the facial aesthetic session, the first session out of 3 in aesthetic and dermatology. These were really excellent presentations and discussions showing the power, the amazing power and versatility of Fotona lasers. So thank you for today. Do you have any questions?
I have a question for you, Adrienne. Actually, it was really very interesting what you did. My question is, with the energy used when you are treating the scalp, of course, not in someone like me who doesn't have hair, if it is someone like you who is having hair, are you worried about the hair? Is the hair going to be affected if you are using the R11 with this energy? It's not going to be burned?
We use the PSO3.
Only the PS03. Okay, even with the PS03, are you making the hair wet so it's not affected, or how do you manage not to affect the hair?
Well, actually, you will improve as an additional benefit of this protocol. When you treat that area, you are promoting the hair growth. So it's something very, very nice.
But without any burn to the hair shaft in this area, the hair shaft will not be affected, even temporarily?
I don't think so. Using 10 stacks, you will go not beyond with the stimulation of between 600 to 800 microns. But still, you can modify according to patient needs, or in some particular cases, we've been using even less energy, 1.5 joules. In some cases, I remember using 1 joule because the patient has sensitivity in that area. But what you don't have to modify is the number of stacks. It's preferable to you to decrease the energy, but not to decrease the number of stacks.
Okay, I see. Sometimes what I do for people who are worried about any hair loss when we are doing the hair stimulation protocol is just to wipe the area with wet gauze. So the wet gauze is going to protect the hair shaft from being affected, and the energy is going to go to the scalp. Of course, not too much wet, but just a little bit, so that it is protecting the hair shafts.
A good tip. That is a good tip.
Very nice. Now, for your protocol, how many sessions did you perform?
4 sessions.
4 sessions.
4 sessions.
What interval?
Between 3 to 4 weeks. We prefer 3 weeks. You can also do 3 sessions, but ideally it would be 4 sessions. It's a very difficult area in terms of if you have seen any other protocols, other treatments, it's a very difficult area to be treated. The majority of the patients that are looking for this type of enhancement ends in doing surgery, because surgery, of course, you can do a surgical lift, but this is a nice option in comparison with other protocols we have been doing.
I totally agree. I have a little bit different experience, because I used to do the same, but with the piano, with a small spot size 6 or 8 millimeter or 9 millimeter spot on this area, while pulling the skin in vector areas. But I think your protocol is much more reproducible. But yeah, I used to do that with the piano.
You could also use Nd:YAG to do this. But I decided to do it with Erbium Smooth because I wanted to stay in the dermis, in the skin. And the hyperstacking technique, you are targeting exclusively the skin.
Perfect. Thank you for enlightening us. We always learn from you.
It was a pleasure. Thank you.
Do you have any questions for Dr. Gabriela or maybe for Dr. Natalia Shanina or Tatiana?
Dr. Gabriela approach is very interesting, and I think it might be promising. However, again, I think we need to learn so many things, especially when there is deviated septum. Is it going to work? Is it going to improve the situation or no? But definitely, I think this is a much safer approach than using injectables, where the outcome is not very much predictable. With the lasers, at least things are under control. So I think this might be a very promising indication. Thank you.
We didn't have any complications so far, and we did quite a lot of noses.
Okay. We are closing the facial aesthetic session now. Thank you all the speakers for great presentation, presenting the amazing power and versatility of Fotona lasers, and see you soon. The second session will be dedicated to body and hair. We will discuss body contouring treatments, tight sculpting, high-intensity Tesla magnetic stimulation with star former, and talk about great non-invasive treatment for hair growth stimulation, hair restart. Let's hear what our experts have to say. Hi guys, welcome. The next session of this year's LA&HA Symposium Aesthetic and Dermatology part is dedicated to body and hair. I would like to welcome Dr. Jorge Gaviria from Venezuela and US, Dr. Adrian Gaspar from Argentina and US, Dr. Tanya Phillips from UK, Dr. Doris Day from US, Dr. Roberto Valdivia Singh from Costa Rica, and Dr. Barry De Keyser from Belgium. Dr. Gaspar and Dr. De Keyser are chairs of this session today. First, I would like to invite Dr. Gaviria to open the session with an overview lecture.
Okay. Well, thank you so much for giving me the opportunity to be here with this amazing panel, good friends. And it's the overview. I'm just going to share my screen and start the presentation. So it was a really big compromise. With Masha invited me to give the overview of what this laser can do in body, and mention something that is going to be a maze for everyone. Now the hair restart treatment that I started with the Fotona laser using my my wavelength for my gynecology process. But as a gynecology, I was looking, using my erbium, but I find out that I could do so much more with my Nd:YAG and with the union of these two wavelengths. Just imagine, I am an OBGYN with my patient, and I am seeing the fingernails on the toenails, and I see onychomycosis. Now I can do it. I see leg veins, and now I can take care of them. I see hair, I see folliculitis, and I can overview all of those procedures. So I was like, why should I stay only in my vaginal canal when I can get more of body treatments And that is something that got me into start with body, then go on and moving into the face. And that's why OBGYN came aesthetic doctor, just trying to follow the steps of the big doctor, Adrian Gaspar. So if we see how can we improve the non-surgical treatments and how can improve with the body, we can see what can we do with the double chin, how can we get the laxity on the skin of the abdomen, or maybe reduce the stretch marks, reduce that belly bulge abdomen that they don't like. Love handles. I just talked to you about vaginal tissues, saddlebags, spermatides, reduce cellulites, and remove unwanted hair. This is from the American Board of Cosmetic Surgery. How can we address that? And if you see, and today we're going to talk about this procedure that is type sculpting that can solve most of these body problems that patients will like to improve. But also we have Erbium for resurfacing. We have the Fotona Smooth for the vaginal problems. And we know that type sculpting is basically a 2D, is two modalities of our laser that can help us to achieve fat melting and skin tightening. So we trigger body fat with skin laxity and skin texture. And this was also developed in the mind of Adrian Gaspar, who has contributed so good in giving us the opportunity to help women with botched liposuctions, with double fat when they say goodbye or they say hi, and reducing measurements and sometimes saving a patient for a liposuction, for a lateral tummy tuck, because improving quality of life is how they see. And this is a marvelous non-surgical approach for this. Type sculpting can be combined. If this patient comes to my office, I will offer her a liposuction or maybe a tummy tuck. But look, after 4 sessions, how can we improve so much on this skin? And maybe she won't need the surgery. So we're looking for life-changing procedures that can be done in the office. And life-changing procedures are something as good as this that we're going to hear today. I don't know, I just love her, and seeing this marvelous result that Dr. Doris Day has, this is a life-changing. And I just hope that this international research can be hopefully approved by FDA so we can have all of these procedures in everywhere in the US nation. We're going to hear my good friend from Costa Rica talking about something that is not with the laser, but is also electromagnetic wave. We're talking about the star former, and this is a magnetic field that is going to do superpulses on the muscles so we can have better tone, and we can lose also measures because it's going to take some of the energy from that fat. So I think that this is just to warm up the podium for this amazing lineup of colleagues that are going to give their best on their protocols. And thank you so much for giving me the opportunity to introduce these amazing colleagues. These are my contact information, and let's continue the good thing about body and hair in this session.
Great. Thank you, Jorge, for this amazing introduction. So I would like to invite our second speaker, Dr. Adrian Gaspar, who will present a study with T-Runner robotic scanner enabling truly effective, safe, and painless solution for treating skin flaccidity.
Well, thank you so much. Hello, everybody. For me, it's also a great pleasure once again being here with all my friends and colleagues and my Fotona family. I will try to show you in 7 minutes the research we have been doing for the last 2 years, but it's very interesting. I think I can do it. And okay, I will share my screen with you and let's get started. Wonderful. Okay. The title of this lecture is the tightening with the T-runner, but using the so-called hyperstacking smooth pulses. Everybody knows that the treatment of sagging skin is by far the most difficult task to do in aesthetic medicine. We have tried a lot of different devices, mostly RF, but the problem is that, again, these are not selective and the energy penetration into the body is relatively slow and deep. So that is the reason why it's very difficult to control and mostly to achieve a good result. When attempting to achieve a sufficiently high superficial skin temperatures, it's not possible to do this with the radio frequency. Even more importantly, with RF devices, it is not possible to heat the superficial tissue to high temperatures because we have determined that there is a crucial temperature that we need to achieve in order to assure a good effect over time when it comes to flaccidity. For both of these reasons, RF treatments are performed either at very low and minimally effective parameters or at levels where the risk of burns becomes unacceptably high. So we know that we have up to now the T-runner with these variable smooth pulses. We can modify the pulse duration from 125 milliseconds to 625 milliseconds. Actually, what we can do with this robotic T-runner, we can separate each pulse, so the total pulse duration is larger, and with this we can get even deeper. We can go deeper in the tissue, and we can accumulate in a safer way higher temperatures very superficial in the dermis, epidermis and dermis. You can concentrate the heat only in the skin, and this is what makes the difference. In the software, as you can see in this picture, in this slide, we have a maximum of 6 stacks. Well, we have been working with different amount of stacks, trying to determine which is the most effective and safest STP in number of stacking, because this is the result is we have observed that will be in relation to the number of stacks and the STP, not in the fluence. Fotona determined when they created this scanner that with the 625 milliseconds, by stacking shots, you can go deeper, which is true. So stacking of Fotona Smooth with longer pulses enables deeper thermal penetration. That is what we knew from the beginning. So, and this is one example of what we did in the past. At the beginning, I didn't know if I did, for example, if I used a 250 pulse duration or a 370 milliseconds pulse durations would be better or not. But then we observed that by using the largest pulse with a large number of stacks, well, the penetration would be by far superior. So this is our research, the tightening with hyperstacking of smooth pulses. The objective of our research was to evaluate the caloric penetration of smooth pulses in durations of 250 and 625 milliseconds, and at the same time to determine which is the most effective number of stacks mode for the treatment of sagging skin. So a total of 15 patients were recruited for this study and treated in the abdomen. 5 of them were also treated in the neck, and biopsies of the abdomen and the neck before and in the follow-up twice were done in these 5 patients. And then clinical histological correlation with immunohistochemistry to determine the pro-collagen formation was performed. So in abdomen, we analyzed these 5 different pulses: 10 stack of 250 milliseconds, 10 stack 625, 11 stack of 625, 20 stack 625, and 2 stacks 625 milliseconds. And in the neck, we did 10 stacks 250, 10 stacks 625, 20 stacks 625, and 2 stacks 625 milliseconds. So for the material method, we used this antibody for procollagen type 1. We did the biopsies with punch, and we analyzed with immunohistochemistry, anematoxylin, eosine, and Mason trichromic. And we did samples for histological study from the abdomen and also samples from the neck. And the fields analyzed were at different depth, every 200 microns in a width of 2000 microns. And it was incredible to see how, for example, in this specimen, we have a 100 magnification immunohistochemistry, the penetration average was 125 microns. The red arrow is showing us a fibroblast positive for procollagen type 1, and then the black arrow shows a fibroblast who has not been activated. Also in the neck, for example, using a 625 millisecond pulse, we really achieved an average depth of 600, between 600 to 700 microns with positive fibroblasts. This is a neck, for example, with immunohistochemistry using 625 millisecond pulse. Again, the penetration was superior. And this is, for example, an abdomen where at 10 magnification using 625 millisecond pulse, 2000 microns of depth penetration. So this is our comparative graph, where you can see here the red is the untreated. Let me use my laser pointer. Here the red is the untreated patient, but look at what happened. The brown is 11 stacks using this one, 625 milliseconds. And here you have the number of fibroblasts procollagen positive and the depth. So up to 1,600 microns, there were fibroblasts activated. And look at what happened. For example, this in yellow is 20 stacks, 225 milliseconds. And also this is in correlation with the clinical results, because we determined that there is a certain number of stacks that you cannot promote more shrinkage beyond that temperature. So the collagen fibers, the elastic fibers, have certain capacity of shrinkage. If you keep on doing stacking, you will not get enough shrinkage, at least at the same session. And look at what happened. For example, the green is 2 stacks, only 2 stacks using 625 milliseconds. And if you compare total amount, this graph here is showing the total amount of positive fibroblasts double at 20 days, average 15 to 20 days follow-up, and increase 4 times, almost 4 times at 3 months, using 11 stacks at 625 milliseconds. But look at what happened in the total amount of fibroblasts. When we finished the 4 sessions, we did 4 sessions, there were not enough fibroblasts activated, but look at what happened 3 months later. Almost the total amount of fibroblasts stayed at the same after 4 sessions, but even after 20 days. But look at what happened after 3 months follow-up in the following biopsies. And if you compare, this is the parameter where we had the best clinical result and histological result. Look at what happened pre-treatment in the total amount of fibroblasts. What happened at 15 days post complete protocol, but look at what happened at 3 months. So the fibroblasts were activated, but they expressed the antibody for procollagen type 1 after 3 months. And look at what happened, the same number of positive fibroblasts accumulated, and look at what happened at the depth. So in depth, we achieved an average of 1,600 microns of positive fibroblasts, who were double number of fibroblasts in the follow-up. This is our one of the best results with my patient. A comparison of abdomen biopsies. I will show you the biopsies taken before and 3 months post 4 sessions. The parameters used were this one. The observation you will see in the picture, post-laser samples exhibit very compact collagen fibers in dermis at 3 months, with less spacing and more thickness, higher resistance when compared with untreated areas. And clinically, the shrinkage and the tightening, she reduced 6 centimeters after 5 months. And this is a temporal magnification before and after. Look at the density of the collagen fibers before and after with 40 magnification. And this, it was in correlation with the clinical outcome. And another important thing our pathologist highlighted to us is the absence of perianexal adipose tissue. This is very common in pathology, such as, for example, sclerodermia, where the amount of collagen is too high and the adipose perianexal tissue is completely disappeared. And this is more or less the same because the amount of collagen that we can find here is huge, that has promoted the disappearance of the adipose tissue. And if you see here, we didn't do L-runner, we just did T-runner. So there is no fat destruction here, only tightening, 6 centimeters less. So this is what we found in this research. The ideal number of stacks could be between 10 to 12. More than that, it's like a threshold that you will not be promoting more shrinkage. You will have good results with 20 stacks. Look at what happened here with 20 stacks, but it's double time to reduce 1 centimeter more does not make the sense. So the indication, flaccidity in any body area, flaccid cellulite, chronic stretch marks, scars, post-bariatric surgery, after pregnancy, severe weight loss. So my personal experience with this mood, with T-runner, enables the achievement of critical temperatures and the precise depth of penetration needed for optimal regeneration procedures, minimizing the risk of burns and making the procedure reproducible. The results are excellent and long-lasting. The treatment is comfortable. The risk of complication is minimal, and the patient satisfaction is very high. This is an example of a hyperstacking with 11 joules, 11 stacks, 625 milliseconds after 1 session. And this is another example after 3 sessions with the same parameters. This is 20 stacks, for example. You see the results are amazing, but it doubled the time. And you can get only maybe 1 centimeter more. It doesn't make sense. This is another example with 20 stacks, 14 joules. An example with 2 stacks, 625 milliseconds, a good result, but very long-lasting result. Another example with the same experience, 2 stacks is faster, but the result is not will not last over time. This is a result with 11 stacks, 625 milliseconds. I have to say that I have in my laser and I'm upgraded. My software has been upgraded in order to I can perform up to 40 stacks. I will never do 40 stacks. This is the same patients, This is another example with 11 stacks, the same pulse duration, and again another one and another one, and another example with 2 stacks, just to show you that you can get good results with 2 stacks. So as a conclusion, excellent and long-lasting results, painless, no risk of complications, no consumables, treatment of all body areas, high patient satisfaction rate. And thank you very much.
Thank you, Adrian. That was great, really showing what T-runner can do. Just to remind our listeners, in the new T-runner software, so the latest for Dynamis Pro family, you can enable up to 40 stacks, but okay, Adrian, as you pointed out, probably up to 20 is still like normal number time-wise also. So now I would like to invite Dr. Tanya Phillips to present her experience with Fotona's signature tight sculpting procedure. So if we combine our tightening also with piano, with long pulse to achieve also fat destruction, we can also get amazing results. So please, Tanya.
Hi, Masha. Thank you very much for that, and hello, everybody. So I'm going to be talking to you about tight sculpting with both the fat reduction and the skin tightening that Adrian Gaspar has just talked about. So this uses both the ND and the erbium part of the SP dynamis, works to destroy fat cells and improve skin laxity as well as skin texture and tone. You can use this anywhere on the body, as you can see from these diagrams, and also on areas on the face. So particularly the chin area is where people come and see us for facial treatment. We use scanners in my clinic, and these scanners I find much more effective. They are reliable, they're fast and extremely accurate in their treatment levels, and you get consistent results with these. So step one is using ND-YAG to destroy fat cells, and as a very useful byproduct, it's also stimulating collagen for deep collagen stimulation. How does it work? Well, we know that 60% of fat cells are destroyed if they're exposed to temperatures of 45 degrees for 3 minutes or more in vitro studies. And what Fotona have done is translated that into in vivo. So with real life patients, we can achieve fat destruction. When we first started on this journey, we weren't using any cooling for this, but actually over time, Fotona have developed this further and found that if you keep the skin nice and cool on the surface, the very useful byproduct of that is that you're pushing the heat deeper into the tissues, and by cycling, you can actually attain higher temperatures deeper into the tissues, causing more fat reduction, and it's also more comfortable for the patient. And their studies have shown that after 4 cycles, you can get to at least 1.5 centimeter depth and be destroying about 20% of the fat cells. So this is a really useful starting point. So this table gives you the parameters of where to start your treatment with the L runner. So cooling level at around 2, temperature threshold of about 38. We're cycling, as we explained before, because it pushes the heat deeper, and the treatment should take around 20 minutes. The key bit to this is doing your initial test patch area, so checking what parameters you need to give you the optimum results. So you set your square to 8 by 8 with the L runner, and what you need to be achieving is a threshold temperature of 38 degrees after 1.5 minutes of heating. Now, if it takes longer than that to get to that threshold temperature, then you can consider either lowering the threshold temperature by a degree, or you could reduce the cold air setting. If it gets to that temperature quicker, then you can consider raising the threshold temperature by a degree, or you can increase the cool air to delay that process. Cooling, I would suggest starting on level 1 or 2, and generally I only flip between those 2 levels. However, with darker skin types, you will need to increase this further. If you need to retest the area, then what's really important is that you use another square away from that first test area, because obviously that is going to have now been preheated by the previous test. So you're cycling around over squares, and if you've got a larger area to treat, then obviously section the abdomen up, or wherever you're treating, into 2 sets of 4. And then step 2 that Adrian Gaspar has now talked about is that collagen remodeling using erbium YAG. And this works with dual action. So you've got the fast heat shocking and you've got slow thermal injury. And this enables collagen remodeling, but also neocollagenesis. And it uses the unique smooth mode pulse from Fotona that Fotona is so well known for, pushing the energy deeper into the tissues in a non-ablative way. And with this again, you're cycling around the 4 squares that you're using, or 2 sets of areas if that's what the area dictates because of the size of it. And you should do at least 2 passes, so 2 sets of cycles for each area that you're treating. And that will give you optimum results. You can then adjust pulse durations and stacks depending on what you want to achieve. And certainly with what Adrian has just shown us, it looks like this is going to get even more exciting. I tend to use measurements so that I can be absolutely clear of what I've achieved with tight sculpting, so with the fat reduction and skin tightening. The easiest way of doing this, and I presented this a couple of years ago in Slovenia, is by using bony prominences, because these don't move. So you use the bony prominences of the iliac crest for abdominal measurements, and then measure above and below that line, depending on the area that you want to treat, and you're measuring the circumferences. As a minimum, I usually achieve 2 centimeters reduction in each circumference area measured. There's some great studies showing the efficacy of this, and we'll all be familiar with Dr. Kemany's study, which demonstrated with CT how much fat was reduced. So I'm going to show you some before and afters. Some of these are mine and some are collected from colleagues around the world. So thank you everyone for sharing these for this presentation. So fantastic results here, and you can see what can be achieved. Again here, this demonstrates what you can achieve with the chin area and the abdominal area. And this is a lady I treated a little while ago. So what we have done here is, this is a lady who had liposuction. She didn't want to proceed to an abdominoplasty because she didn't want the downtime of that. And so her plastic surgeon referred her to me post-operatively for me to then treat the skin laxity and a little bit further fat reduction. And you can see after just 3 treatments, she's got a fantastic result. And actually, as a byproduct, her stretch marks are also significantly better. And I show you this just to demonstrate how much can be achieved in a non-surgical way, and that you can treat all skin types. And it's just about being careful with the parameters you use and adjusting the cool air. So in summary, the tight sculpting technique is an incredible technique that gives consistent results with no downtime. And it's unlike any other fat reduction treatment that you can get. Most of the other treatments on the market will either do fat reduction or skin tightening. I'm not aware of any that does both with such great success, which leaves very happy patients, which leaves me a very happy doctor. Thank you very much.
For the last 2 years, Fotona Hair Restart has become a very popular new Fotona applications. The reason is that there are many patients that seek the treatment for hair loss, and Hair Restart represent an excellent non-invasive solution. Dr. Doris Day has done a study on patients with androgenetic alopecia showing excellent improvements in hair growth and prevention of further hair thinning. So please, Dr. Doris Day.
Thank you. I'm excited to share my data. So I'll share my screen and then bring up the presentation. I have all of these things on my screen. I just put it here. 1 sec. Oh, here it is. All right, so it's my multimodal approach to non-surgical hair restoration. And we know that hair is very much tied to our self-esteem. And we don't choose to care about hair, but when we have beautiful, thick hair, it makes us feel and look more beautiful. And it tells other people that we're healthy. And it's just hardwired into our DNA to see hair in that way. So hair is very powerful and very important. And it's also important for facial framing. You can look 10 years younger. When I post pictures, I cut my hair off. I used to have long hair and I cut it short. And on all my posts, the most comments I get are about my hair. And it also looks thicker when it's shorter, but it really frames your face. And a good haircut can really make our fillers and our other treatments look so much better and different or worse, depending on what the hair looks like. And hair loss is really common. So it's as common in men as it is in women. It can start very young, and there's lots of reasons behind it, which we know so much about, but we want to get to the idea of what we can do about it. So we know that many people suffer from this. It's a huge part of our population, and as we age, your hair naturally ages, but on top of it, you have stress shedding from everything going on recently, and then you have also the androgenetic alopecia, and the stress shedding can exacerbate that male or female pattern hair loss. So there's lots of reasons why people have hair loss. And when I address it on many different levels. I find that when you have a multimodal approach, everything you do works so much better. So there's lots of things I have my patients do at home, whether it's topical minoxidil-based solutions. I make my own version of it that has caffeine and niacinamide, home low-level laser treatment, supplements, whether they have little toppers that they wear, and also in office, there's prescription things we can use, PRP, exosomes, and then Fotona for me has been a total game changer for hair loss. So I want to get to what we do for hair loss. So the Fotona, I had heard about it at one of the meetings and then started to do it because my patients, 30% of my practice, on top of everything else, is men and women complaining of hair loss. So I love my Fotona. We kind of compete because I have a nurse who does so many things with it as well. So we really, this is our most used laser out of the 30 devices I have in my office. And we use the erbium YAG component of it for our hair loss patients. So we use the PSO3 handpiece, and we do it in a crosshatch pattern. And I believe that the energy from the laser stimulates dormant hair follicles to promote hair growth. And we usually do 12 laser sessions, not 8, but 12 now at 2-week intervals. And I find that works a lot better. And I have people who come from all over the world who tell me that of everything they've done, adding in Fotona to their treatment regimen has made the difference in growing back their hair. And if any of you treat hair loss, you know that our hair patients can be the most frustrating patients because we want them to be happy and to see a difference. And all they see is hair shedding everywhere. And they're typically, it takes a lot to make our hair patients happy. So when I see my patients with hair loss come in and say, I'm growing hair, I'm shedding less, let me tell you, I'm happy too. I'm as grateful. And I believe it's a process called photobiomodulation, which is a form of gentle deep heat that stimulates the stem cells of these dormant follicles and encourages hair growth. And this light energy penetrates the tissue where it interacts with chromophores, and then there's a complex set of reactions, all of which we understand yet. And that can lead to increased circulation, reduced inflammation, and helping to restore cellular function. So it's really telling the cells to wake up. One of the things I've noticed is I treat a lot of frontal fibrosing alopecia. And in those areas, we see scarring, but I still treat those areas. What I realize is that next to the scarring, you may have dormant hair follicles that are more stunned. They're not scarred, but they're affected by the surrounding inflammation and scar. And I've been able to regrow hair in those areas, and they do super well, with or without adding in steroid injections. So these are the settings that we use. We use the erbium PSO3 handpiece, 7 joules per centimeter squares, 7mm spot, and about a 3.3 hertz speed. And we do it in cross-hatching pattern over it. And then we just go back and forth. You just part the hair. So it takes about 10 minutes to cover the entire scalp. And I focus on areas where you have hair loss. And I just kind of go back and forth over the whole scalp. That's the idea of how it's done. And then I sometimes combine this with PRP. So when I do PRP, I do the hair laser first and immediately after the PRP or the exosomes. So I always do it together in the same treatment, but I also do the Fotona by itself. So here are some before and afters of patients who've been really happy with their results. I say it works in about 85% of my patients. Some people do just the Fotona, and then I try to add in the drops and the supplements, but some people just choose to do one or the other. But like I said, I like combining it. This is a young man who we've been doing Fotona. None of these people are on Propecia or spironolactone. And he's really happy that his hairline is filled in. Another one, a young woman devastated by her hair loss. We're fighting genetics, which is really tough, especially when it starts this young. And she's really happy that she has more hair. And this is a lot more hair. And then we just keep going, just patient after patient, just really happy that their parts are narrower. They can style their hair better. Their hair feels thicker. Even the quality of the hair is better. And then we have one patient, you can just see the part is better. We always try to go to the worst part, but this was a patient who had alopecia universalis, and she was devastated by it. So I've been treating her, and we've been only doing the Fotona, and we've been growing back hair beautifully. And we've been treating her every 2 weeks. It took about a year to get to here, but I think we are reducing inflammation really nicely. And then I was just treating her husband just for fun as well, and he did really well. Can you get my charger? And this is another patient who is also doing well. So not everybody does great, but this is a young woman who has really terrible hair loss where we can entirely see her scalp. So for her, this is a nice improvement. And more patients with results. So I am convinced that this works, that it has benefit, and my patients are super happy.
Thank you, Dr. Doris Day. We are moving forward to our last presentation in this section. The newest addition to Fotona aesthetic line, it's called Starformer, a high-intensity Tesla magnetic stimulation heat device that enables muscle to strengthen, tone, and firm without an effort. So Dr. Valdivia Singh will present his experience with Starformer.
Hi, Fotona family. For me, it's an honor to be sharing with all of you. And today I will share with you my experience with the Fotona Starformer device. And as you may know, non-invasive body sculpting is one of the most desired treatments in this day. Starformer is our most recent device that uses HEAT technology. And let us execute our new tight weight treatment. Tight weight is based on high-intensity Tesla magnetic stimulation technology and is used for straightening and building up muscle, decreased fat tissue, and body shaping. We can achieve these results that I will share with you soon by getting maximal contractions, supramaximal contractions. Okay, so I will share with you some clinical cases and how to pick the ideal patient and what to expect from this treatment. Okay, this is a 32-year-old man, healthy. He has been working out for 10 years every day. He is a very athletic young man. He wanted to achieve a better looking abdomen and definition. I performed 8 tight wave sessions every day apart on Monday, Wednesday, Friday. The treatment was 40 minutes long with several steps, including different frequency modulations in order to achieve stimulation of different muscle fibers. The treatment was painless and well tolerated by the patient, and the intensity is increased up to individual tolerance level of each patient. As you can see, there's great results on body shaping and muscle thickness and definition of the abdomen. Here's another case that I would like to share with you. In this case is a 29-year-old man, healthy, and as we can see, he had a little more fat than the past case, and we can also achieve good results. It's important to know this treatment will bring better results in patients without overweight, okay? Same parameters and the final results should be seen after 2 months, okay? As we can see, there's a lot of improvement in muscle building and fat reduction, okay? Now, this is getting better because we can combine our treatments. This young female is 32 years old. She's healthy with some fat and also some flaccidity on her abdomen. So she wanted to improve it. So we performed 6 sessions of tight sculpting every 3 weeks apart, and the previous mentioned protocol for tight wave. Okay, 8 sessions, great results on skin quality and skin tightening, and also we can see great results on muscle definition and thickness. Okay, There is another nice case because this patient obviously had indication for surgery, but she didn't want it. So we start doing the tight sculpting to improve the skin. And this is the result after 6 sessions of tight sculpting every 3 weeks apart and tight wave. As you can see, there's a lot of improvement in the skin quality and skin texture also. And we can see how the muscles pops up and brings a really nice definition on the patients. And they were all really happy with the results. And now these are my tight sculpting parameters that I used. But now on, I will take the recommendations of Dr. Tanya and Dr. Adrian Gaspar for my next patients. I would like to share some patients that I treat on the glutes, also achieving good results by lifting and making more beautiful appearance of the back. Okay, and I will share this another one with good results by lifting the glutes. And one of the things that I love of this treatment is the satisfaction of the patients. All of them were happy with the results. Also, they said that they will recommend this treatment to other potential patients, and they are willing to pay another cycle of treatments too. The report cases that I've been done is 30 patients. 30 patients were treated and complete the protocol of 8 sessions, 3 per week. 30 of them, I mean all of them, report to be satisfied with the results. So I will move on and show you. This is an MRI. 6 MRIs were performed in randomly picked patients. Result cross-sectional MRI analysis show an increase in thickness of the rectus abdominis muscle of 41 to 90% and decrease in subcutaneous fat layer above the rectus abdominal muscle of 26 to 6% of decrease of fat. Okay. Now I will show you a short video. And this is tide wave. It's a non-operator dependent treatment. It's quick, painless, and reliable. And as I said, very nice results and great satisfaction of the patients. Well, thank you very much. This is a picture, it's a selfie from Ljubljana Castle, where everybody knows is the company headquarters in Slovenia. I hope everybody will be happy and excited to try the new Starformer. Thank you all again, and I will let my contact number, email, and social media, so you can contact me or reach me whenever you want. I'll be in touch. Thank you.
Thank you, Dr. Valdivia. Yes, that was a great presentation on this new technology from Fotona. I would like to thank all of the presenters, and I would like now to ask Dr. Gaspar and Dr. Dekesser to open a discussion.
Well, thank you so much for these great presentations. I keep on learning always. And I have a couple of questions in relation to these wonderful talks. The first one is for Dr. Tanya. Excellent, Tanya, excellent. Congratulations. You did a great job, really. I would like to ask you if you can share with us some tips and tricks in order to achieve better results with your protocol tight sculpting.
So I think for me, getting that test patch right in the first place is really important with the L runner. And I think that gets missed off by a lot of clinicians. So we're just going straight in, and I used to do the same. You go straight in and just see where you get to with it. But getting that right is really important. I sometimes will use local topical anesthetic just so that I can get the heat high enough. But with the cool air on the surface of the skin for fat reduction, it does work really well. The only places that patients are a little more uncomfortable is over some of the bony prominences. And then with the T-runner, I was really excited to hear what you've done with the stacks there so that we can get even better results. Because at the moment I'm doing sort of combining what I've got on my system, but I'd really like to get deeper stacks. And I think looking, as you do, at the patient that's in front of you, looking at their skin, and so it's not one size fits all. It's, you know, is it crepey skin? Is it deep tightening? What do you need to achieve? And adjusting the parameters depending on what's in front of you.
Okay, well, that's great. Thank you very much. Dr. Valdivia, I have another question for you. Apart from to say congratulations for your great experience is amazing. Do you think the combination of these Starformer protocol, the ones you are using with type sculpting, is the ideal protocol for non-invasive body contouring? Why?
Corey, it is, okay? Even more important when skin is compromised. If you find flaccidity or skin laxity, there's no other way that combine the tight sculpting with the Starformer. And I said that because obviously lasers will improve skin texture, skin quality, and obviously flaccidity. But when you gain the thickness of the muscle, it will improve also the skin to stretch up and look even better. Like I said in the presentation, I think when we find skin laxity, there's no way to avoid using Starformer to improve these tight sculpting results that you already mentioned. Great, but if we gain some volume by the muscle, the skin will look better.
Well, and according to your experience, your vast experience combining these two protocols, which the best protocol for you would be? Suppose, I don't know, how many sessions would be ideal, how many sessions of a Starformer, how many sessions of type sculpting, according to your experience?
Okay, according to my experience, I will start by 4 sessions. And I said to my patients, I don't know how it's gonna work with you, but that it's gonna work, it's gonna work, okay? So I perform from 4 to 6 sessions and every 3 weeks apart. So I start first with tight sculpting, doing 1 or 2 sessions, and then I start doing the tight weight treatment with the Starformer because it's a quicker treatment, and I will finish and obtain my final results a little bit closer. So when I have my final results on tight sculpting, I will already have achieved the muscle treatment fully done. So it's a good way to start combining these kind of treatments.
Okay, and you know, in my experience, at least in Latin America, women are have so level of anxiety with these treatments, and they asked me, doctor, when am I going to see the results? In your experience, after how many sessions you start seeing your results?
Okay, I said to my patients that they will feel, and that's very important, they will feel better even from the first session, because they already feel the intensity of the contractions and they feel they have worked out, okay, feeling without doing exercise. So that's a great key for us, because we can say to the patient, okay, I will see good results 2 months before the treatment is done, but immediately you will feel stronger. You will feel that you have worked out, and that's something that patients love and brings them back to the office to take the treatment.
Okay.
That's very exciting for us and for the patients, because they leave the office happy, saying, okay,
that's right,
I want to come back again.
I couldn't agree more. In my experience, after the very first session with types, I'm talking about type sculpting, my patients see the differences immediately. Yeah. Well, thank you very much. Tanya, I have another question for you. I saw you showed a very nice case in darker skin. Do you have any experience treating, for example, stretch marks with the T-runner in darker skin?
So I would, with that particular lady, if she were to come back again, the bits that I would probably do next for her would be using the F-runner on the stretch marks. So to just improve the collagen over the stretch marks. So I quite often will do a combination of tight sculpting and then the F-runner, and that gives really nice results. And again, you can do that on the abdomen or anywhere else on the body where they've got stretch marks, either post-op or from pregnancy.
Nice. Another consultation purpose that we have in our daily practice when it comes to aesthetics is and body contouring is cellulite. Do you have any experience? Do you treat cellulite with the type sculpting protocol?
I do, yeah. So I'd use the T-runner, the L-runner and the T-runner, but I don't tend to do so many cycles with the L-runner, so with the fat reduction. So I tend to go 3 cycles rather than 5 cycles, and that's enough to give me a good result with it, and then deeper tightening with the T-runner.
Okay.
And you can see the change, as I'm sure you've seen straight away, you know, photos before, photos straight after, and you can see the difference immediately.
Wow, excellent. I have one more question. I don't know if Jorge is here. Is Jorge here? I can see you. Yeah. Jorge.
Yeah, I'm here.
You're here. Hello, my friend. How are you? Well, I saw you in Instagram that you were treating a double chin patient with a double chin using the runners. Could you please tell us something about your experience treating this type of patients?
Well, that is a good question, because everybody wants to get the type sculpting to act in double chin. As Tanya just explained it, the principle behind type sculpting is cooling tissue so we can trap the heat inside dermis, travel to hypodermis, and get the fat melted. But overexposure of time of this is what is going to create that. What is the only problem here? That we only have maybe 1 square of what Tanya was talking about. She was talking about, let's do 4 squares, let's do cycling. What is the problem? The problem is that we need to fix the temperature threshold. We can increment our simmer, our air cooling devices, but instead of cycling, we need to understand L-runner, and we need to see what is red, what is yellow, and what is green. And we need to cycle between our pedal. So we pedal, we go to red, we let the pedal go, we let the air cooling go to yellow, we don't let it go to green, and we start it again. Red, and those are the cycles. The cycles will be start, stop, start, stop. And of course, the article about the time exposure is that we need to have that little area being exposed for more than 4 or 5 minutes. So when we're doing double chin, 1 little spot, but try to maintain that energy level, because what we're measuring with the matrix view is temperature, surface temperature. But as we're cooling the surface, that temperature cannot come out. So it's trapped there. So that temperature inside will be almost the same. And then hyperstack as you're doing it, and for the neck. And as you were showing that my neck doesn't finish here. My neck is all the way back. I treat all cylinders. Arms or legs in the full 360. It's not just the area.
That is very important.
That's what I do in neck. Thank you.
Okay, thank you very much. No, I have no more questions.
Okay, thank you, Adrian. I would like to ask Dr. De Keyser, because you also have a lot of experience with Harry Start, maybe to give us your perspective and also discuss with Dr. Doris Day about the Harry Start.
Absolutely. Is Doris still here?
Yes. Yeah, she's here.
Thank you so much for this very nice presentation.
Thank you.
I just wonder, when you combine your biostimulative laser and PRP, you choose always PRP and lasers together for all patients, or sometimes maybe you just use laser therapy or PRP?
For every patient who gets PRP, I bundle it with the laser. So they don't necessarily have to do the 12 sessions, but before PRP, I always treat with the laser. So I draw the blood, and while the blood is spinning, I do the hair lace, and then we review their home care, and then I do the injections at about 10 minutes or 15 minutes later. But yeah, I always do and every patient will tell me they've had PRP in other places, but when they combine it with the Fotona, it works so much better.
Exactly, we see the same in Belgium. Yeah, absolutely. Yeah, you do 12 laser sessions, which is a lot, like 6 months of therapy. How do your patients react to this session, this treatment protocol?
Well, one of the things, and I think Dr. Jorge Gaviria wants to say something too, I'll just say quickly that one of the issues that I've heard other people complain about is that they'll say that afterwards some patients notice scaling and itching of the scalp, and that means you use too much energy. So one of the things that's really important is this is a low energy. You're stacking, it's just like we're doing with the rest of the treatments, which I found incredibly fascinating, and I'm going to go do so much differently now. I'm really excited to go treat my patients. But with the hair, you're also trying to reach the follicle, which is kind of deep. You don't need to affect the surface of the skin very much. So by moving quickly over the surface and doing more passes, you're stacking that energy deep without causing burning of the superficial skin. And I think that is one of the differences. So if your patient comes back and they say their scalp was burning or they had a lot of itching and scale afterwards, move the energy faster, maybe go a teensy bit lower in the energy, and pay attention to that skin. Jorge, did you have something you wanted to add?
I wanted to have this opportunity to have you and Barry being here, because you know that in USA, like Fotona is limited to talk about hair restore. So they are relying on internationals, trainers like Adrian or myself to talk about when we're doing the training, because they cannot do it. So is it that in the US we don't have like a protocol, and there is a lot of people that has been in medicine regenerative, and they go like, I have been doing PRP, and I think that sometimes the LADs will activate the PRP. Should we do the PRP first? Should I do it after? What is more beneficial? Actually, and one of the users said that they are using also the laser as a low-level therapy for analgesic effect. So maybe after injections, that analgesic effect. So why will you say is the best way to approach the PRP first, the PRP after? And hearing about Adrian, are you going to use your T-runner on the hair restart? What do you say, this Doris and Barry?
I would stick with the PSO3 handpiece, because I think the T-runner might go a little bit deeper than what I would want for this. I'm not sure that the energy would hit the target as well. And also you have to be careful when you're treating somebody who has hair, because you really don't want to overheat the hair. So I tend to just do where I have the utmost control. And with the PSO3 handpiece at the size I use it, I can really control where I'm driving that energy and make sure I'm reaching the part of the scalp that I want to hit without hitting hair or causing other issues. So, you know, these are things that I'm always exploring. I think it's kind of interesting to think about all the other hand pieces we have and the ways we can use them. But I tend to be one to sort of not necessarily blaze the trail, but make the trail better. So I wait for maybe Barry to try it, and then and once he figures it out, I'll go, and then I'll figure out another pathway to sort of amplify and build on it. So I don't know, Barry, would you do the T-runner?
I completely agree with what you are saying. One of the things that we have to struggle every day with beautiful ladies with longer hairs, I always have to do my best to really part the hairs and just to read the skin. And I think that's one of the main advantages of the PS03 when you compare it to hair max or other low-level laser therapies. They hit the hairs. I don't think that we have to hit the hairs. I completely agree, we have to hit the skin.
And I think this works so much better than low-level laser that people do at home. It's completely different. I have patients who use the low-level lasers who don't get results and who do this. So I think this photobiomodulation is different than the low-level laser that they're getting at home. We're controlling the energy. We're hitting the follicle very specifically. We're stimulating cells. We're not just only improving circulation. I think we're actually waking up stem cells.
Thank you.
I don't know if I can share something about the hair, if that's okay.
Of course.
Hey.
Yeah, please.
That's a curious question asking about keeping with the PSO3X and the T-runner and the depth of how this will bring results in every part of the skin. And I think on her is really important that the layer, the skin of the part of the keratinocyte is the part that suffers, I think, more than the other parts. We're not looking for collagen improvement or tightening of that skin. So that's very important when Dr. Doris Day said that she wants to keep this superficial treatment. So I think that's the key to treat and see good results and the difference by using the T-runner and the PSO3X. And very good results. I love your job, Doc.
Thank you. Thank you.
Maybe I have just one more question for Adrian and Tanya. What do you think, very experienced as you are, about the future of body sculpting and body contouring? Is it really, is it tight sculpting combined with star format, or what's your idea about it?
Well, after seeing the incredible results of Dr. Valdivia, I'm strongly convinced that the combination of the muscular approach, the adipose tissue approach, and the connective tissue approach would be the ideal protocol to offer to our patients. Well, we need to go beyond. We need to do the following step will be to determine which the best protocol will be according to the type of patients, of course. But I feel that we are in the right way at the beginning of the road, starting working with these amazing pieces of technologies. And after seeing my own results, your results, everybody's results here and everywhere, I do believe that this is a great combination. That is my opinion.
Yeah, I agree. I'm going to be getting the star former so that I can do a study looking at two arms. Oh, can you hear me?
Yeah, it's okay.
Yeah. So yeah, I'm looking forward to getting that so I can do a study whereby some we're actually treating with just tight sculpting and some we're going to treat with both and see what the results are like and try and do a direct comparison between the two as best we can.
I want to say something also. We're talking about body treatments, and we're talking about body contouring and what is the future. I am definitely sure that my good Dr. Doris Day will say there is no resurfacing, there is no treatment on the skin without any sunblock. Okay.
Oh my goodness! Thank you so much.
Now,
What I would say.
We're talking body contouring. We need to understand that sometimes like 80% is nutrition and exercise. So if we don't change the chip on our patient, there is no star former, there is no dynamics or type sculpting that is going to work on that patient. So we need to, as we explain that the need of aftercare when we're doing some of the face or some of the treatment with the laser, we need to tell them that they need to change habits and they need to create good hydration, like Adrian said, good nutrition and exercise on this.
But I think that when people see that they have a nicer body, they're more motivated to then continue and have the good nutrition. And sometimes a lot of this is patients who do exercise and they work out, but their body distribution is this way. And so we can help them redistribute their own body fat by contouring where they need it. Sometimes they can have less body fat where they want it and not enough where they don't have it. So we can, and I think, and that's one of the things is that some people will notice that after we do some things for their waist and their hips and their thighs, that their breasts get a little bit bigger if they gain a pound or two, because that's where they still have fat. So, I think it is motivating for people to sort of get in the program, but it is a conversation I have with every single patient when I do body contouring, is that I'm going to help you have the body you want, but these are the measures you need to take to get you there faster and to maintain it. And it is a complete conversation. That's such an important point.
Yeah, completely agree. And we need to be aware of body dysmorphia as well and be careful that we're treating the right patients and not just enhancing somebody else's distress by treating them inappropriately. So it's being really careful with all of those things, but we need to do that in all of our aesthetics too.
Yes, thank you all. So yeah, we are closing this session of body and hair. Thank you all the speakers for great presentation and really excellent discussion.
Thank you very much.
The third part is dedicated to pigments. From unique multimodal melasma approach with extra long follow-ups to treatment of pigments on Asian skin with Starwalker MyQX and discussion about the highly regarded Starwalker PQX system. Hello guys, welcome. The next session of this year's Laser Health Symposium, Aesthetic and Dermatology part is dedicated to pigments. I would like to welcome Dr. Leonardo Marini from Italy, Dr. Lucas Chia from Singapore, Dr. Sebastian Velez from Colombia, and Dr. Julio Cesar Velez from Colombia, Dr. Bill Lin from US, and Dr. Taro Kono from Japan. Dr. Marini and Dr. Chia are chairs for this session. I suggest that we have a discussion in the end, at the end of all the lectures. So, Dr. Marini, I would like first to invite you to open the session with an overview lecture.
Thank you, Marcia. Thank you. And it's a pleasure to be with Fotona family again, even if online. So next year, we hope that we're going to have this kind of meeting live again. So I'm going to share my screen now, and I'm going to start my presentation. So pigments. Everything is pigments. Because in life, we recognize pigments because colors are very important to give a message. So from painting to nature and to even faces of our patients. So we know that specific laser and light-based devices can be used to effectively treat selective pigmentary skin alterations. We have endogenous pigments, as you can know, exogenous pigment, tattoos, and of any kind of exogenous pigment we're going to discuss later. And of course, talking about exogenous pigment, superficial mix and dip, and according to the location. And of course, when you have an increased pigmentary changes, nature of pigment, we can have a high number of melanocytes, high number of melanosomes, and both. So these are our targets. Then we can have reactive endogenous hyperpigmentation like melasma, post-inflammatory hyperpigmentation. So we need to deal with these pigments very carefully. So this is just an example of what we can treat. And this is a long-lasting progressive worsening melasma. We did, in this case, a microdermabrasion, hydroquinone, a mask followed by cysteamine cream. And this was the results that we obtained after 3 months. So pretty impressive. So we can also induce melasma with laser if you don't pay attention to parameters. This is, for example, an article that tells that we can have a periorbital following high melasma following high fluence 1064 Q switch. So be careful when you use laser. Post-inflammatory hyperpigmentation, we always face this problem. We can have an early and late observation. So we need to have a great experience is required to adapt effective correct treatments according to high-personalized psychological, pharmacological, and physical strategies to deal with these patients. So epidermal melanosis, solar lentigo, and of course, we have an increased number of melanocytes. We have a cafe au lait macule, which is an excessive number of melanosomes. And of course, you can have cafe au lait macule associated with neurofibromatosis type 1, which is an increased proliferation of epidermis and melanocytes, epidermal melanocytic hyperplasia. Nevus aborta. So this is can be dealt very successful with our lasers, and this is just an example of a combination technique. This is another example using the 1064 multiple Q switch laser passes fractac technique, and this is 3 months of the 3 treatment. Look at the quality of the skin, look at the improvement we can have with our lasers. Then we have, of course, people enjoying the sun too much, and this is a multi-layer spot rejuvenation of the face technique, which is a multiple kind of laser we use, including the Q-switch laser. On the hands, we have no limits, so we can use this kind of combination technique all over the body, except for the lower legs, which are reacting very slowly. So I don't recommend you to use even gently the Q-switch laser on the legs because it takes forever to heal. Exogenous pigments, tattoos, we can have beautiful results with the fractional priming and fractac technique. You can have this kind of results 60 days after full procedure. Fractac technique for post-traumatic tattoo. And this is these are very tough cases. This is the original tattoo. This lady went to another, 2 other offices to get the tattoo removal. She developed a scar. So this I call a resistant tattoo. When you have this kind of resistant tattoo, no matter how intense the parameters of Q-switch laser you do, you're never going to get enough clearing. So in this case, we use the fractac. We use the fractional priming, and then you can see the modification of the tissue. Look from here to here, what kind of improvement we can have with the combination technique. This is another resistant tattoo with a fractac technique. You can see from here to here after 6 procedure. And difficult cases. We can use Q-switch laser to treat argyria. Argyria is a rare condition characterized by blue to slate gray pigmentation of skin and mucosa membrane consequent to ingestion of ionized silver. So it is working using the Q-switch laser after single pass. So this is cases that we can, of course, consider. So this is an analysis from the literature treating argyria, and we can have nice results in selected cases. Chrysiasis, from the Greek chrysos, gold, It's a distinct permanent photoactivated skin pigmentation. So we have a clear correlation between severity of pigmentation and the cumulative dose of gold. So we have mild, moderate, and severe, and these are the aggregate of filamentous electron-dense material. So we can use, in general chrysiasis, we can use a pulse dye laser, and you can have this kind of result. These are the treatment we can offer to our patient. And also, using the 755 long pulse electron dye, using these parameters, you can have much improvement in this kind of difficult to deal pigmentation. Then you can have cutaneous siderosis, which is a persistent deposit of elemental iron from dermal subcutaneous IV injection dermal macrophages with perivascular periannexal, distribution. And then, of course, you can deal with this with the 532 Q switch and the YAG laser. Look at the results 6 months post 4 session. And this is our case. This is post-sclerotherapy hemosiderin intrasubdermal pigmentation with a Q switch laser again. So after our injection, another first Q switch laser treatment description that was published, and this is was published in 2001. Then, of course, you have exogenous ochronosis, which is asymptomatic, but is very unpleasant to be seen. So we can treat ochronosis with non-pharmacological measure, pharmacological treatments, and of course, procedural treatments. We can use a Q switch 755. You can use Q switch 695 Ruby, but also we can use the Q switch 1064 full beam, fractional beam, laser, and we can also use erbium YAG laser at the fractional blading mode combination with 1064 Q switch laser, full beam, and other techniques. So laser has always a role in this pigmentation. Then we have hyperpigmentation associated with drugs like minocycline ingestion. And this is a typical case that was treated with the Q-switch electron dye, and this is a very nice kind of results you can obtain. Another pigmentary changes due to minocycline, you can see 1 month after a single session of Q-switch 755 and non-ablative 1550. So step 1, 1550 non-ablative, step 2, 755 Q-switch. And with this, I conclude my overview of the pigmentary alteration we can deal with laser, and I like to give the podium to the other speaker. Thank you for your kind attention.
Thank you, Dr. Marini. That was really great overview on pigmented treatments. Our next speakers are Dr. Veles, who will be presenting long-term results in multimodal patented melasma MACOX Clear treatment procedure with Starwalker.
Hello again, everybody. For us, it's a pleasure. As Dr. Marini said, we wish that next year we can meet together at Slovenia. Today, we are going to talk about the long-term follow-up in our melasma treatment. Of course, we have to remember for this treatment, we are using the Starwalker. We also want to share with you guys that we already published the article of the first patients we made, the first 20 patients. You can search for the article, or we can share the article with you guys. As I was saying, we are using the Starwalker for have our results, and of course, the adaptable structure pulse technology is that the thing that we think is giving us the possibility of have these kind of results and make the difference. We want to begin, remember, in this little video about the physiopathology of melasma. We have this little schematic drawing of the skin. We are going to have different harmful factors, especially the ultraviolet radiation, the high visible blue light, and the infrared light that is going to oxidate in different ways different parts of our skin. The first part that are going to have these harmful factors is of course the keratinocytes up in the epidermis. This is going to make up paracrine signaling to the melanocyte and activation of the melanogenesis. Of course, we can't forget that we are going to have damage also in the dermis, the elastin and also the collagen. And this is going to lead to the activation of the fibroblasts that have to repair that damage. But this is going to lead also to some inflammatory pathways that is going to activate vascular proliferation, but also melanocyte activation. Because what the immune system and fibroblast is going to understand is that this is a physical harmful factor, not a biological harmful factor. And the only way to protect our skin from this harmful factor is to make a bigger pigmentation of the area to resemble something like a shield that protect us from the penetration of the different kinds of radiation that the sun is giving us. And so we are seeing here the hyperactivation of the melanocytes. Of course, this is very schematic. We are not showing the real biological pathways that we can have. And all these are giving us the symptoms that we can found in our skin with melasma. And that's why we want to remember that we can't see the melasma just as an stain. And we have to see the melasma with all the factors that we have in melasma, the photoaging condition that the melasma is. And we insist in our definition as a photoaging condition. You can look and you can remember the definition that we put together. So go ahead. That's why this is the treatment approachment that we are using. Of course, using sun protection, we discontinue all the triggers, not only the hormonal triggers, but the inflammation in the whole body. We use topic therapy, and of course, a 4-step laser treatment that we have shared with you in past years. This is what we are doing. This is the first step. We are using the full stop modulated acoustic Q switch to get rid of the pigment. We are using here higher fluences that we used to use because we can hear the pulses and it's going to be more didactic. Then we use frag 3, but in really low fluences for the inflammation and for a small rejuvenation treatment. And this is the fractional that we are using. This is maybe the main step, the principal step that we think that is making the results possible. And when it is possible, we also use the ND-YAG to treat some visible vessels. Also, we use magnification to search for some vessels, and we treat those. And as I said, for us, it's really important that the third step of the treatment, of course, using the principle of LA&HA or laser-induced optical breakdown, we can achieve with the fractional handpiece this kind of injuries of the skin, but without thermal damage. Depending on the fluence, we are going to have different kind of damage, as you see in the pictures. And just for remember, this is the 4 steps laser protocol. We are treating the patients every 15 days. We use topical anesthesia and also cooling. And in some cases, if it is necessary, we are using antibiotics and antiviral prophylaxis. This is our parameters. You can study the parameters, but it's not the principal issue of this presentation. So this is what we want to share today, the long-term follow-up on melasma treatment. We perform a survey asking the patients enrolled in the study about the satisfaction. The average satisfaction is 84%. About relapses, we have 15% of relapses after 2.5 years of follow-up, with average pigmentation of just 2.5 over 10. And the recommendation level for the treatment of these patients, it's going to be 19%. Let's see some example of real long follow-up. We are talking about almost 2.5, and in some cases 3 years of follow-up without maintenance sessions, just with using antioxidants, without hydroquinone, just to see the difference that we can achieve with this kind of approach. We had shown this lady to you and all the other patients to you, I think in the Fotona weekend 2019, but this was after 1 year, and this is the way that she looks right now. As you see, she still have an improvement of the pigment. This other lady over here, she's getting a little relapse of the stains, but she's much better than in the beginning. This picture was 1 year or 9 months after the treatment, and this is right now. As you can see, after 2 years and a half, she have a little bit of relapse, but she is still being much better than in the beginning, without maintaining sessions and without the use of hydroquinone or other melanogenesis inhibitors. This is after 12 months, and this is after 30 months. So they keep with the improvement for a long term. Another case, a beautiful case, a difficult one, and this is also 30 months after the follow-up. Other picture of the same patient, as you can see, and we insist in that the thing we think is giving us the difference is the rejuvenation effect of the fractional Q switch. The other side, 12 and 30 months. This is the case that we showed to you. She left the treatment because she wasn't able to support. She was scared because of the sound of the laser, so she only performed three treatments, and she was like this after 12 months, and after 30 months she keeps with a real great improvement, and she didn't finish all the 6 sessions of treatment. Of course, we are waiting for our PQX to compare what we can perform with this and with the MAQX. And we think that the best part of this is going to be the combination of both machines. So let's see. And if you are asking yourself if we treat men's, of course, we also treat men's. And you can see these kind of results also in men's. And that's all that we wanted to share with you. Thank you, guys, and we hope to see you again as soon as possible.
Thank you. Wow, that was fascinating. Amazing results after 2 years and even longer. So I would like to present now our next speaker, Dr. Lucas Chia, and invite him to present his experience with treatment of pigments with multimodal Star Walker MAQX, which is the perfect answer to pigmentary disorders. Please, Dr. Lucas.
Thank you, Masha. Hello, everyone. Warm greeting from here. Today, I shall share some of the clinical pearls of the use of Fotona Star Walker in the pigmentation remover. Now, this very simplified illustration shows some of the very commonly seen pigmentation that collectively account for more than 90% of the pigment cases that we treat at our centers. Now, of all the Q-switch lasers that I have used in my career, now the unique Star Walker Pico and Nano pulse coupled with the other laser modalities such as the Fractry, the Versa and the Verde KDB laser has given me the clinical achievement and the sense of satisfaction beyond all others. Now let's first talk about these freckles. Now, freckles do not warrant any treatments unless solely for cosmetic reasons. This protocol with a gentle approach is what I like to use to avoid any unforeseen side effects. A more aggressive approach can be used to treat what I call the impatience doctor and the patient. Now, it is targeted at the freckles until the mild petechia is observed. The clearance is expected in less than half the normal time needed. There are also some protocols on the green toning. I do use this long pulse KDB Verdier laser. It can be a solitary or an add-on stat with any of your MAQX parameters. The freckles clearance with Star Walker is highly effective and predictable. If you happen to come across any non-responding case, then perhaps you should need to reconsider your diagnosis or get your machine serviced by the Fotona. Yeah. Now, next, we talk about the landogenes in the form of the solar or the Sana subtypes. They can be easily removed with the MAQX or the long pulse KDP Verdier laser. You start low and you go slow. The Verdier laser long pulse KDP has the pulse duration from 15 milliseconds that exert the selective photothermolysis as opposed to photoacoustic. The risk of the PIH is lower. I prefer to use the Verdier for the landogenes on older and drier skin type, as well as those found on the limbs, as it is much safer to do so. Mild cases of seborrheic warts, they can be removed with the Verdier laser too. However, for more hyperkeratotic lesions, a full beam erbium yak with a R8 handpiece is what I generally consider as an ideal choice. With suitable parameters and technique, the seborrheic warts with any of these associated landogenes, they can be easily, effectively removed in just a single sessions. Now, as we move a little bit deeper to the dermis, and we shall discuss these two dermamelanosis, namely the nevus of Horis and the nevus of Orta. Now, let's start with the nevus of Orta. Okay, we all know that nevus of Orta, they can be effectively treated with the MAQX 1064 with large spot size is what I use. The highest success rate is associated with the initiation of the laser at a younger age. Okay, we start the treatment for this younger at the age of a 13-year-old, a great response after just about 6 to 8 treatments. This younger was about 16 when we started the treatment. The complete resolution was achieved only about 1.5 years later. This is a 40-year-old lady, underwent the monthly MAQX, the results after 1 year and after 2 years. These two pictures are taken 3 years later, 6 months apart, and the last picture was taken 5 years later after the start of the first treatment. The response of nevus of Orta's improvement in the adulthood to laser is painstakingly slow. It causes frustration to both the doctors and the patient. Now, we would just have to accept that, do we? No, we don't, because our good friend, Dr. Marini, has published something that I perceive as a game-changing treatment regime. Now, this technique primed the skin with a fractional erbium yak prior to the Q-switch anti-yak laser. Impressive result is seen after about 2 treatments. Given the suitable Fitzpatrick skin type, I think this is a marvelous technique that is certainly worth a trial. Now, let's move on to another dermamelanosis, which is the nevus of Horis. Very commonly seen in this part of the world. They're also known as the acquired bilateral nevus of Orta-like macules, acronym for ABNOM. The only proven treatment is the Q-switch laser. The treatment is done at about 6 to 8 weeks interval. Now, I've not seen more frequent treatment could do any further benefits. Successful or near successful treatment require up to 1.5 years. This is an aggressive treatment with large spot size and high fluence. Please use a cooling as much as possible. The end point should be the visible intralesional petechia. Okay, let you see the improvement after about 18 months later. Another lady with complete removal of the nevus of Horis after about 18 months. Now, histologically, the nevus of Horis and nevus of Orta looks very much alike. It's very possible that if you prime the skin with a high fluence fractional Q switch or the erbium yak, like what Dr. Marini did for the nevus of Orta, we might be able to achieve a faster improvement. This is what we believe. Now, with any aggressive treatment, it comes with a greater risk. This white spot, yes, they are the laser-induced goutate hypopigmentation. These are the true melanocytic damage or even the melanocyte. Hence, please do not overtreat any dermamelanosis. Be patient, you will get there. Now, the last part of my presentation focuses on the post-inflammatory hyperpigmentation. Like all of you, I don't have the best solution apart from the moisturizer. now, but I have something interesting that I would like to share with you. The PIH is generally categorized into epidermal and dermal origin. Conventionally, the hydroquinone and the sunscreen, along with some other physical and chemical treatments, have been used. We all know that these treatments would help the epidermal lesions, but they show no effectiveness in the dermal PIH. Now, let me show you two interesting cases that we have used our Fotona system to treat the PIH. The first case is a subacute to chronic post-inflammatory hyperpigmentation from derma, where multiple remedies have been tried for about 10 months, but to no avail. Now, with just a single sessions of a multi-shot pulse fractional erbium YAG with a FSO1 handpiece, we could actually see quite a good improvement. The exact mechanism of how the erbium YAG laser in reducing the PIH is not entirely clear, but most likely attribute to the exfoliation process. The second case is another PIH caused by acne, as well as iatrogenic aperture peaking of the acne lesions. The results shown 2 sessions of combination of the MAQX factory and the fractional erbium YAG. Now, we also have some experience with the use of a fractional MAQX FS20 handpiece, and the result has been encouraging so far. Regardless, a step up in the post-laser moisturizer is the key to the successful improvement of the PIH. I've come to the end of my presentation. Thank you, everyone. Stay safe and please stay in touch.
Thank you, Dr. Chia. Excellent presentation. Our next speaker is Dr. Bill Lin, and he will speak about his experience in treating Asian patients with Star Walker.
First of all, I should give thanks to Dr. Chia because he's my great mentor. He always told me a lot of things, because I've been, practicing using Star Walker for less than 2 years. And he's always helping me, with Asian skin type. So Asian skin type is very hard to deal with because of the type, they're always type 3 or type 4. So it's very hard to deal with in the beginning. But with more practice and more experience, I find out that, if you follow all the standardized protocols, you should have safe, results, safe outcomes. Yeah. So let me share with you some of the results of freckles and melasmas. So this actually, I think it's melasma. I treated her 2 times only, and this is before and after, only after 2 sessions. So I used low fluence, NDAC 1064, and then followed by verdict on those, epidermal, melasma pigments. So this is the results after 2 sessions. I think the most important things to follow is that the endpoints. So for 1064, I think the endpoint is mild, very mild erythema. Okay, so if you don't see the erythema, I think you just need to do it more passes. If you underdo it, then you won't see that much great results. I think that's my understanding of the 1064. So it's all about endpoints. And then with the 532, the verdict, the non-pulse 532, I think the endpoint is mild, very mild frosting. And then if you don't see any endpoint of frosting, then you have to need to bump up the fluence in order to see the frosting endpoints. So I think in the conclusion, it's all about endpoints. And especially for 1064, it's very hard to see the endpoint. So you need to practice, seeing with your own eyes, the very mild erythema. So that's my conclusion. Guess what? This, to be honest, I think she has a mix of freckles and melasma. Correct me if I'm wrong, Dr. Chia. He's my teacher. Yeah, so this is actually after 2 sessions. Okay. Again, I used a very low fluence of 1064, and the endpoint is very mild erythema, followed by, actually, this is the verdict, same thing. And then also another tip is that if you use verdict 532, because it's very easy to get PIH on Asian skins. So what I do is that I use very low spot size. That's more enough to cover the lesion. Nothing bigger outside of lesions. Otherwise, you will see PIH. That's my tip. Yeah. And then with the freckles, with the verde, same thing. Mild frosting would be good enough. Yeah. And also, very importantly, on Asian skins, post care is very important. So freckles, whenever I use 532, I always give hydrocortisone to prevent PIH or other like the hydroquinone for only a few days. Otherwise, it's very easy to see PIH in Asian skins, to be honest. So that's my another tip. Yeah.
Good.
Perfect. Thank you. The last speaker of this session is Dr. Kono from Japan, who will be presenting the latest addition in the StarWalker family, StarWalker PQX.
Good day, colleagues. My name is Dr. Taro Kono. I'm a plastic surgeon at the Tokai University, Japan. It is my honor and pleasure today to be a speaker at the LA&HA Symposium. Today, I'll be talking to you about StarWalker PQX treatment. Since the introduction of selective photosynthetase, short-path lasers such as Q-SIT laser has been used in the treatment of pigmented lesions and tattoos, especially in dark-skinned patients. The complications are common, such as hyper and hypopigmentation. Recently, a picosecond laser is investigated. The ultra-rapid temperature changes introduced by picosecond pass generate strong acoustic shock wave within the target compound, resulting in the tensor stress that is exceed the fracture threshold of the target. This mechanical or photoacoustic effect is a preliminary method whereby tattooing particle and cellular melanosome are shattered by picosecond laser irradiation. The path dilation of StarWalker PQX is 300 picosecond and is one of the shortest path dilation and picosecond lasers in the market. The wavelengths of StarWalker PQX are 532 and 1064 nanometer. StarWalker PQX can be used to light solar lentiginous. The left slide is a 56-year-old male patient with light solar lentiginous. The setting is a 532 nanometer, 0.8 joule per centimeter per 300 picosecond with 3 mm spot size. You can see slight atrophy formation immediately after laser irradiation. A class formation was seen after 3 to 5 days and epithelialized within a week. These are UV images. Melanin is decreased a week after laser treatment. These are erythema image. Erythema is increased a little bit a week after laser irradiation. Slide right is 4 weeks after one treatment. Light solar lentiginous completely disappeared. Hypopigmentation was seen in a week, but there's no hypopigmentation is observed in 4 weeks after. A slight erythema was seen in a week, but no erythema is observed in 4 weeks. The slide left is a 69-year-old female patient with light solar lentiginous. The setting is 532 nanometer, 0.8 joule per centimeter square, 300 picosecond with 3 mm spot size. Slide right is 6 weeks after one treatment. Light solar lentiginous are completely cleared. Data UV image before and 6 weeks after one treatment. No hypopigmentation. Erythema image before and 6 weeks after one treatment. No erythema. The left slide is a 90 years old female patient with thickened solar lentiginous. The setting is 532 nanometer, 1.02 per centimeter square, 300 picosecond with a 3 millimeter spot size. Slide light is 6 weeks after one treatment. Thickened solar lentiginous can be improved using high fluencies. The summer relaxation time was defined as the time taken for the central temperature of a Gaussian temperature distribution with the width equal to the target diameter to decrease by 50%. However, stress confinement is not considered in summer relaxation time. Stress relaxation time is shorter than summer relaxation time, and star Walker PQX is short enough to clear stress relaxation time of melanoma. The pulse duration of star Walker PQX is 300 picosecond, and it is one of the shortest pulse duration in picosecond lasers in the market. Wavelengths of star Walker PQX is 532 and 1064 nanometer. Additional wavelengths 585, 650, and 785 nanometer are coming, and I look forward. This is the last slide. In the treatment of pigmented lesion, QSET laser is the gold standard. However, the risk of this pigmentation is quite common in especially dark-skinned patients. Picosecond laser less than 500 picosecond is highly effective with less complication. Thank you for your attention.
So I think we can open the discussion, Masha.
Yes, I agree.
Okay, so excellent presentation, and the take-home message for everybody is that modern Q-switch laser, picosecond laser, and the Star Walker special pulse are the way to go if you want to confine the thermal damage to almost nothing. So we are pushing, we are encouraged by this technology to push this technology to our limits, because treating post-inflammatory hyperpigmentation is always been quite a challenge. Treating melasma, it's always been quite a challenge with different kind of pulse, longer pulses. So we are really breaking the rules here, because the old say was once melasma, always melasma. Once rosacea, always rosacea. So this is what we know. But maybe with a new technology, with the experience and the results that we were able to see today, we can have new horizon opening. So dealing with Asian skin is always a big problem. And also in Colombia, you have this kind of dark skin individuals. And I think that laser technology is a big jump towards the success, but I think also that we need to combine treatment with a proper post-laser skincare. Post-laser skincare is fundamental if you want to decrease the inflammatory process, which even if is minimal, but is there. Another important issue is if you want to treat post-inflammatory hyperpigmentation, you can treat with the low fluence fractional ablative Q-switch laser followed by steroid. So in the same session, so you can use this as a penetration enhancer, and you combine the two treatments together, and this you can have a much faster and much better results in post-inflammatory hyperpigmentation. So this could be another option that we need to consider. What's your opinion, Lucas?
Yes, Dr. Marini, I do agree with you. The post-inflammatory hyperpigmentation is quite notorious to treatments. The steroid certainly works very well, especially if you are treating something that happened quite recently. Now, some of the PIH that happen, especially on the limbs, they can persist for months and months to years, and they are very resistant, extremely notorious to treatment. So we have some experience using the ablative laser. They work to a certain extent, but certainly not to our full satisfactions. Yes, I do agree the steroids is good, especially when you come to the new cases. Now, going back to your another statement that you have made, excellent statement that the Asian skins, we have to be extremely careful. Lasers, when you're treating with the Fitzpatrick skin type 3 onwards, is really about determining the right and safe skin type and using the safe and low fluence in the treatments to avoid all these adverse events. Okay, that's about.
So, any comments from the other speakers? So I totally enjoy the presentation provided by Julio for the two Velez brothers. I think that it is a good result that you obtain with melasma. But again, so we always see some relapses. Because, you know, this kind of people, unfortunately, they are prone to react with this kind of hyperpigmentation. So I think that it is a nice way to offer a nice, let's say, arrow in our armamentarium to provide this kind of treatments that you propose. But again, I like to stress that we need to be informative to our patients and not to promise anything which is solving the problem forever. Otherwise, we're going to end up like at the beginning of our adventure with epilation, where we promise, you know, that's no more hair, and we got a lot of doctors that went bankrupt because they couldn't, you know, of course, keep the promise. So people pay a lot of money for nothing to get just the hair regrowth. So I think that it's very important to get this kind of innovative techniques and innovative strategies properly placed in our, you know, armamentarium in order to get a nice way to offer this kind of combination treatment, because personalized treatment, every patient is different. So you need to really, yesterday we did a very nice webinar on epilation for the European Society for Laser Dermatology. It was in-depth jump. So we jumped deep into all these aspects, and really it's a personalized treatment, even in hair reduction. So very, very promising results. And I think that Fotona has been always at the forefront of technological innovation. I like the pulse they develop and the reliability of this Q-switch laser. Remember, the Q-switch laser can be very temperamental. So the rods are very difficult to keep stable. And Fotona was able really to get this kind of stability. I've been working with the Star Walker for many years, from the very beginning of its release, and I'm very pleased about what I can obtain. So it's a combination that always gives you the best results. This is my opinion.
We totally agree with you, Dr. Marini, about the melasma. As we say, for us, the melasma is a photoaging condition, and you can treat the photoaging, but the aging is going to continue. So the relapses is prone, and what we are showing right now is our results, long-lasting results of the first patients that we treat, and those that we showed in 2019 on Slovenia. But of course, in the regular basis of our treatments, we use both the laser and, of course, a skin treatment after and before the treatment, the laser treatment, and of course other strategies as like oral antioxidants and other things, because we think and we know that those are necessary for for have long-lasting results. And also we explain to our patients that they have to do maintaining sessions. What we explain to them is don't think in the stain, don't think in the pigment. Think you are going to rejuvenate your skin each treatment you make. And that is a way you can go into the head of your patients and convince them to do the maintenance sessions. I have a comment also about the corticosteroids. We use corticosteroids only, soft steroids like prednicarbat or aceponate of methylprednisolone, just in some cases. For example, when we treat solar lentiges or we treat athletes, because if we have a lot of inflammation, we are going to have that post-inflammatory hyperpigmentation. For us, the Native American skin and the half-blood skin are very similar to the Asian skin. It's not the same, but it's similar. And we use these steroids only over the lesions because I don't want to intervene in the pathways of inflammation. For example, I develop with the fracture, I just want to avoid the inflammation over the lesions. And in melasma patients, we avoid that kind of treatments with corticosteroids, but some patients requires. That depends, and as Dr. Marini said, we have to individualize our patients, and as we said, we have to make something like tailor medicine, like when you go to your tailor and measure all the parts of your body, and everybody is different to each one, to the other. And for example, I can treat my brother with some parameters today, but in 1 month, those parameters are going to change because his skin already changed. So we have to think in that way.
Excellent. So this is an excellent point that you just mentioned. Every patient is not only different, but it's behave differently according to the, let's say, stage of the aging process, all the system and how its or her system reacts. So according to the many biological, internal equilibrium. So you are never the same. We are dynamic individuals, and as dermatologists, we need to read the skin. And read the skin, read the patients. When you're able to read the patient and read the skin, then you make less mistakes. But if you're not able to read the skin and read the patient, then of course mistakes are behind the corner, in spite of the technology you're using.
That's right. And also we have to understand, and as a dermatologist, we have to study in this moment something that is the stress adaptive system. Our balance between our sympathetic and our parasympathetic system, because if the person have an hyperactivation of the sympathetic, the pigmentation is going to worsen. The CRH and ACH are melanocortins, and if we are full of those stress mediation in our blood, we are going to stimulate the melanocyte and we are going to worsen the pigmentation. So we have to go and to understand our patient as a whole person, not just like skin. We are going to treat only the skin.
This is another good point. So treat the patient as a whole. An holistic approach is always winning. Because the skin, is just a peripheral part of a complex environment. So we need to analyze the whole environment, the whole body, which is acting differently according to internal equilibrium, as you mentioned. I noticed in Bill pictures, the one we were able to see, I discovered that he's doing some secret treatments on hair because. He doesn't want to share with us, but I understood that he was doing something. So Bill, analyzing your picture, I saw that after your treatments, you decrease also the porous number, the pore size. So the skin got much smoother, much better. So this is the treatments that the kind of side effects, which is the rejuvenation effect we can use with the Q-switch laser. What do you think?
Okay.
So I cheated a little bit. I used the SP Dynamis with the factory because that's much faster. And then you can also with the bigger spot size. So I use the factory spot size from 4 to 9 and then 0.3 to 0.6 milliseconds. Because actually the reason there's a 0.3 and to 0.6 milliseconds is because it targets a different chromophore. So the factory, we know it's non-invasive, 3-dimensional targeting the imperfections. So I used the SP Dynamis. And then I found out that the pores, they get better, and also their skin rejuvenated. In terms of the skin elasticity. So that's why I have now the great results from 60s from SP Dynamis. Overall, yeah.
Yeah, guys, I have information for you. We are updating our Star Walker MAC-QX with a 0.3 millisecond pulse. So aside of 0.6, which is now built in as a factory, we are also introducing 0.3 milliseconds, which we call the Accelera, and which we had also in our previous Q-switch system called QX Max. And some people who get used to this pulse duration wanted it back. So with the new software update, you can get also 0.3 milliseconds in addition to already existing 0.6.
Okay, do we have any more questions or should we wrap this up?
Well, I think that's
Dr. Marini or Dr. Chia?
I'm fine, thank you.
Okay.
I think we cover most of the issues about difficult to treat, pigmentary changes of the skin. And thank you all the speakers. Thank you all the presenters. Thank you, Fotona, for inviting us. So it's always a pleasure to cooperate. It has been a very nice experience and live discussion. Talking with experts is always a good exercise because we share and learn. So thank you very much for participating to this session.
Yeah.
Thanks.
Thank you, guys, and hope to see you next year. Really,
Live.
truly live.
Okay.
Pray.
Okay.
Thank you.
Bye.
Ciao. Ciao.
Bye.
Thank you.
Bye.
Bye.
The last part is pre-communication, where different Fotona users will present their best cases and protocols.
Hi everybody, thank you Laser and Health Academy allowing me to share some of our smooth eye protocols step by step. I'm proud and honored to be here as a Fotona family member. My name is Dr. Romina Kabir, Director and owner of Sanasut Clinic, and I'm joining you from Norway today. Today I'm going to present 3 cases of our smooth eye protocols with Fotona SP Dynamis. As you know, periocular area is a problematic area to treat with the most of laser wavelengths. However, I-beam JAK wavelengths is completely safe to use on this area as long as the eyelids are closed. Stimulating collagen remodeling and contraction of the skin can be achieved using different modalities in order to reduce wrinkles and volume around the eyes in a minimally invasive way. Here we have the first case. Female patient, 56 years old, complaining about her heavy eyelids and wrinkles around the eyes. Here we have done 2 treatments with 3 weeks intervals, and the 3rd picture has been taken after 3 months. As you see in the picture, we have done smooth mode with PSO3X 4 joule, 6 stack, 1 pass, and 4 passes with 1 stack. It's important to mention that stretching the skin is the key when we are treating eyelids. We did step 2 with FSO1 90.8 joules, SP mode, and 3 passes. In the 2nd treatment, as you see, we have done smooth mode with PSO3X 4 joule, 2 passes with 4 stacks, and 3 passes with 1 stack. The focus is more stack on the problem area. On the upper eyelids, we have used FSO1 19.8 joules, SP mode, 3 passes, and on the lower eyelids, we have used PSO3X SP mode 4 joule, 3 passes. The patient was happy and didn't want more treatments. Here you can see also the same person and the same result from the site. The second case is a female patient, 49 years old, smoking. Here we have done 4 treatments with 4 weeks intervals using almost the same protocols as the first one. Smooth mode with PSO3X, FSO1 19.8 joules, SP on the upper eyelids, and PSO3X 4 joules, SP mode on the lower eyelids. You can see the eye lift and reduction of wrinkles on the lower eyelids. We will do the maintenance treatments after 9 months. The third case is a female patient, 49 years old, who didn't want any downtime. So we have done only 1 treatment with a smooth mode PSO3X, 4.5 joules, 4 stack 4 passes in all area and 6 passes on the corner of upper eyelids. And here you can see the result after 1 treatment. And also in this picture you can see the contraction of skin on the upper eyelids. Thank you so much. Here is my email address and Instagram ID. Please don't hesitate to ask if you have any question. I would like also to thank Fotona LA&HA Academy for inviting and giving me the opportunity to share some of our experiences. Thank you so much and keep safe.
Hi everybody, good day. I'm Dr. Jessie Chong from Penang, Malaysia. Here today, I'm given an opportunity here to share in the LA&HA symposium on some of the clinical cases based on my user experience with the StarWalker PQX as well as the SP Dynamic system. So without further ado, allow me to share with you some of the cases which I have collected across the time using these systems to further advance the course of this academy and hopefully benefit all of you along your practice as well. So the first case here is a young patient having acne issue as well as PIH lesions on the face. I've employed the StarWalker PQX fractional handpiece F5 as well as the black 8 and 4 millimeter handpieces to treat her. So the endpoint that I aim for is definitely some mild erythema after the F5 as well as a slight darkening of the pigment areas over the acne PIH scars. So as you can see, in 1 month, some of these active pimples have shrunken, as well as some PIH has definitely lightened a lot. And next treatment session definitely would be warranted. And also because there are also some slight new acne popping out. So I hope further sessions can be helpful to these patients to reduce the lesions as well. The next patient is a young girl looking to enhance the overall skin tone. My parameter here is using the StarWalker F9 and black handpieces. I use the green handpieces to lighten the freckles slightly. I did not go with a very high setting. I only merely have 1 stack on each of the area, and slight darkening of the freckles was seen, and we can see appreciable reduction in the freckles. And overall, the skin tone has lightened and improved a lot in this patient. The next case here is a melasma patient who's been being treated by me across past year or so. We've been trying multiple rounds of hydroquinone, tranexamic acid, as well as multiple sessions of peel switch lasers. With that, she was quite resistant to the treatment, and we find that it's not really helpful. So upon acquiring the PQX system, I'm able to use a fractional handpiece as well as the black handpieces in combination in order to reduce the pigments quite significantly with just 1 treatment sessions. So this is after 4 weeks of her treatment. Let me show you the side view of this patient as well. So we have here the reduction across and overall skin tone improvement as well. In this case, the control is becoming much easier these days as I can give her treatment using the PQX system. Next one is a young patient with acne scars. Here I'm looking at his scars formed since his teenage years. So some of these box scars were able to be significantly reduced using just 1 session of my PQX. I combined the F9 and F5 handpieces. They are the fractional handpieces. I aim for endpoint of petechiae and erythema with 2 to 3 stacks across these acne scars. And there was no complication. The downtime was slightly long, between 3 to 5 days, and he finds some amount of itchiness at those areas during recovery due to the inflammation as well. But the LIOB effect has definitely proven its prowess in resurfacing the scars quite effectively in this patient. Next patient is a patient with acne and PIH with the combination of SP Dynamis and PQX. The first step with SP Dynamis is mainly to reduce some of the fine facial hair, as well as to get the patient some skin tightening as well, to reduce the pores. And also the PQX system is used in combination of the fractional handpiece and the black 8 and 4 millimeters. We were aiming to reduce some of the pigmentary changes across the skin. And you can also appreciate the pores have improved, the skin texture has improved over 1 month after the treatment. So these are some of the patients with Fitzpatrick skin type 3 to 4, especially common in Malaysia, my population group. So it's proven to be pretty safe in my group of patients. The next two cases are of tattoo removal using a fractat system. So for this left group of pictures, I have the first treatment done, and immediately after, this is the frosting that we observe after the fractional handpiece, and also followed by the black handpiece 4 millimeter to produce the frosting. So this is after the first treatment sessions, and this is after the second treatment session. So there's definitely significant lightening of tattoo compared to the left top corner, the original tattoo, with just merely 2 treatment sessions. And since this patient has Fitzpatrick skin type 4 to 5, there's definitely no PIH development here, that as we can see, and patient finds that the process is tolerable. This is another patient also using the fractat system. I used the F9 and black handpiece 4 millimeter for the same. And the last case in my sharing is with a patient with overall skin rejuvenation required. And as you can see, I combined the SP Dynamis Frac 3 setting first, followed by the PQX to use the fractional handpiece and 8 and 4 millimeter handpiece to overall tone the patient's skin and create also texture improvement. And of course, to assist with some of these 4 refinement as well, I also did a Urbiumiac MSP mode. We call this the ultra light peel as well, followed by the SP mode Turbo 2 to target specific ice pick scars areas. So I find that overall improvement in this patient is really impressive after 1 treatment session with almost 1 day of downtime only. And we are able to get this sort of result, and I'm pretty pleased to share with the patient as well as with all of you. So in wrapping up my presentation here, I find that the Starwalker PQX is able to extend a lot of treatment benefit, especially to cases where I have stumbled upon walls with my conventional Q switch system, as well as to offer higher value to my patients in terms of clinical outcome, and to extend also a high level of safety when using this system. Thank you so much for your time. Again, I'm Dr. Jesse from Malaysia. I look forward to your correspondence or any feedback to my presentation. Thank you so much, everybody.
Hello, everyone. I am Dr. Jorge Baños. I'm aesthetic doctor based in Mexico City, and I'm really excited to be here with you all to share my experience with the Starformer device, this amazing body muscle sculpting magnetic stimulation machine that's going to help us attack or offer a different type of treatment option for this part of the body sculpting that was a bit neglected by the industry before. So first of all, I want to talk real quick about what we are achieving with this type of devices. We're achieving a super maximal muscle contraction, which means that the 100% of our muscle fibers of a muscular group are going to be fully contracted on each stimuli. And we're going to achieve 20,000 super maximal muscle contractions per treatment with Starformer, which is really important to attain a really good hypertrophy of the muscle that we want to treat. So then I'm going to share with you the protocol that I use, that is the one recommended by Fotona. Each session lasts around 18 to 35 minutes. We do the sessions at least twice a week, 1 day minimum of rest between sessions, completing a total of 8 sessions, and the maintenance sessions can be 1 each 3 to 6 months, depending on the type of results that we want to achieve or that we achieve, and the habits of exercise of the patient. Then I'm going to show you some cases. First of all, this is a male of 28 years of age. He's used going to the gym and doing functional exercise 5 times a week. He has a BMI of 23, really good, healthy diet. he had an abdominal fold of 4 centimeters to 5 approximately. And we did this result. This is before and after pictures after 4 sessions, twice a week. You can see here the obliques are getting more marked and he got a bit more cinched. This is the volume reduction that my quantifier system is measuring here at the medial part of the abdomen. And at the 3/4 view, you can see that he got more marked at the obliques part, comparing this side to this one. So this is a really good result. But then we completed 8 sessions. The first, we did 1 session twice a week till we completed 4 sessions, and the rest of the 4 sessions to complete the 8, we do it on a weekly basis, just once a week. And you can see here from the basal picture of the patient to the 8th, after the 8th session, that he got a more flatter abdomen with a more reduction of the central part. And this picture from the top, I'm showing you the before and after of the patient that this part he already received 4 sessions, and this is 4 sessions more. You can see the change here at the obliques and how the abdomen is way more flatter at this part, and you can see it more at the part over here. And my quantifier system is measuring it here. This is comparing the basal picture when he started till the 8th session. He lost around 1,300 milliliters of volume here at the central part. So this is a really good result of a patient that has really good habits. Then I'm showing you another male patient, 37 years of age, with a good BMI and also healthy diet, with an abdominal fold of 6 centimeters. And you can see here that it's a considerable change. It's not that amazing or impactful, but when I measure it, I can see here with my system that he lost 200 milliliters. And when we see him from the side, we can see here that he has a more erect, more flat abdomen than in here. Here he had a more inclined abdomen, and now he's more erect. What we got to the conclusion is that he got a hypertrophic rectus abdominalis here, so that's why from being inclined, he achieved it more straight. And he refers that he has more strength and more assistance when he practices abdominal training at the gym. And we also can see here that he lost 37 millimeters, around 4 centimeters of circumference at this part of the abdomen, which is really interesting as well. We've got a female of 29 years of age. She does cardio 4 times a week. She has a good BMI with an average diet with an abdominal fold of 5 centimeters, and we just did 5 sessions twice a week. We can see here from the frontal side that she got a bit more defined from the sides as well. But here at this part of 3/4, we can see that she got even more defined. And by the side view, we can see that the medial line of the rectus abdomen is more marked, as well as the lateral part. So she's really happy with just 4 sessions done in 2 weeks. At this part, we've got another female of 29 years of age with a less BMI, with an average diet, lesser abdominal fold, and also with 4 sessions. As we can see here that she's got a flatter abdomen. We lost this type of donut at the peri-umbilical part. And here my quantifier system is measuring that she lost some volume at this part. And at the 3/4 view with the clay view of the abdomen, we can see that it looks more flatter, that she lost more volume from the central part. And last but not least, I've got this really good result of a buttock augmentation with the star former. She's a really sedentary patient. She's not used going to the gym, and she wasn't going. She has a 19 BMI with a really bad diet, but with 8 sessions twice a week, we achieve a really good gluteal projection and augmentation. We can see here that it looks more rounder than here, with a little bit more projection here at the lower part. And my quantifier system is measuring that she gained 500 milliliters of volume at the gluteal part. And here in this video, we can see that with the measuring tool, she gained around 5 centimeters of volume at the lower part of the glute. I'm going to play it again. You can see here it's starting at 37 millimeters, 38 of gain, around 3 centimeters on the upper part, around 4 centimeters on the middle part, and around 5 centimeters out at the lower part. So she's really happy with the results, as well as am I. And at last, I want to talk real quick about the patient expectations. In my experience, these are really good treatment for a patient that exercises regularly, has a balanced diet, and has a really good night's sleep. This is really important because our night sleep is going to dictate how we gain muscle mass at the next day, and in general, how we regenerate our body. So it's important to communicate with the patient that the results will be maintained accordingly to the patient exercise habits. Just as bodybuilders lose volume when they pause training, that's going to happen the same. We could augment the volume, the muscle thickness with this type of devices, but if the patient is not used to continually growing it at the gym, he's going to lose, or she's going to lose, the results. But even if the patient is not fit or lean, what I have seen is that they perceive a good result as an incremented muscle strength when they tend to do exercise, more resistance, and overall posture enhancement. So to finish, I just think that we have an amazing technology, but we just have to acknowledge its limitations and sell it right. We have to do honest marketing, and directing this to the right patient, we're going to see really great results, and we're going to have really happy patients as well. So that's it. I'm really glad to sharing with you all my experience. I'm Dr. Jorge Baños again, aesthetic doctor based in Mexico City. Here's my email and my Instagram for any information that you would like to have or any comments that you have from my sharing experience. And I hope I see you again around sometime soon.
大家好，我是深圳香槟丽格医疗美容诊所黎金雄医生。今天很荣幸在这里和大家分享Fotona 4D 抗衰老亚洲面部特征的一个解决方案。那谈到欧洲之星Fotona 4D 的亚洲方案，首先我们要了解亚洲人和欧洲人的一个各自的一个面部特征以及审美追求。欧美人的面部是比较立体的，他的审美讲究棱角分明的一个骨感，整个脸看起来瘦而立体，散发出比较强的一个气场。而亚洲人，特别是以中国为代表的东亚人，审美是讲究瘦而饱满，比较喜欢瓜子脸和心形脸，整个面部的轮廓曲线比较圆润平发。那两种不同的审美，这里呢在做Fotona 4D时，不能全盘按照厂家设定的参数或者模式来治疗亚洲面孔，否则很容易水土不服。那在Fotona 4D 的4种模式中，以 Piano 模式最有代表性，在秒击脉宽 Piano 的模式下，通过对真皮深层及皮下脂肪组织的一个真脂发的一个加热，同时进行溶脂和紧致提升，这种模式在解决下颌线不清晰或者双下巴的时候非常好用，但是在进行面颊部操作的时候，则容易造成面颊部的一个凹陷。那面颊部凹陷对于欧美人而言是一种骨感美的表现，但是对于追求面颊部饱满的亚洲女性而言却非常的不友好。比如在中国的传统的审美观念中，面颊部凹陷、颧骨较高，常常被认为是女性刻薄的观感。那所以针对亚洲人面部特征及审美需求，急需解决的问题是将Piano模式中的溶脂和紧致提升独立开来，在进行面颊部操作的时候，是紧致提升而不溶脂。那如何才能够实现这两种效果的分开？那有的医生的方案就担心导致面颊部凹陷，他们没办法，真的是降低能量，延长治疗时间。但是能量降低虽然不溶脂，同样也无法达到紧致提升的效果。目前Piano模式对真皮深层和皮下脂肪层的真脂化加热，在治疗思路上是想通过激光在面颊部的一个平敷加热真皮深层及皮下脂肪层，以达到溶脂和收紧的效果。那我一直在思考，那能不能不用全身的Piano平敷，能不能解决这个问题？答案是肯定的。那面部的一个支持韧带、斯马斯和真皮与神经膜和骨膜的锚定点，是起到一个支持固定及相应区域面部的皮肤和皮下组织，维持正常的一个解剖位置的一个作用。那我们思路打开了，下一步就要考验我们的技术了。在Fotona 4D 操作中，结合面部解剖学和韧带的分布，通过适当的定位及路径，运用脉宽调制技术，采用精准定点的治疗方法，对韧带进行 紧致提升，突破了4D 在 PL 模式下紧致的同时溶脂的固定模式，而实现了紧致提升和溶脂局部溶脂的独立使用，从而有效解决了 PL 模式下进行面颊部输紧实曲线的一个凹陷问题。那具体的操作方法，我采用的是高低加的方案。那先利用高能量迅速升温，那高能量大概是用到350到450焦每平方厘米的高能量迅速升温，让靶点位置迅速达到治疗温度。那这个时间甚至可以缩短到60秒到120秒。然后是一个低能的一个微温，那低能是160到200焦每平方厘米的能量，利用激光的光调作用调节细胞生物活性，进行组织修复和再生。那最后再进行重点部位的加强，那我们用到260到350焦的一个能量，最主要的需要加上冷喷对重点部位韧带的锚定点的一个加强。那高低加的方法不仅能够有效的进行紧致提升，而且可以给韧带组织复活，恢复韧带的拉力，在治疗过程中可以获得事半功倍的效果，不仅及时效果立竿见影，而且能够让效果更加的持久。
Today I will represent you 6 new laser applications and 6 new laser protocols I developed last 2 years. This is case of melasma patient. She came to my clinic a year before she started her first laser treatment. I wanted to tell you that it was fractional CO2 laser in another clinic. Before that, she underwent a lot of other procedures, starting from chemical peel, hydroquinone, tranexamic acid, arbutin, for example, or other over-the-counter cream. But results were very weak and she was very upset. As you can see here, we are dealing with dark skin type. She has Latin American origin, 42 years old. In the background, she has chronic inflammation, bronchitis, infection with chlamydia infection, anemia, and what is very important that she had a problem with coagulation. With these problems, we decided to treat her with combined laser treatment using Q-switch and the arc laser, using short pass and the arc laser because we wanted to destroy melanocytes and to work on very superficial blood vessels which were present under the pigmented, hyperpigmented area. And finally, we use fractional Q-switch laser because we wanted to destroy and to remove epidermal melanocytes and keratinocytes. So it was very important that we have longer follow-up and results are very, very successful. This is the same patient as I described as melasma case, but we had another issue because she wanted to have rejuvenation. And because of that, we focused the perioral area, and we didn't want to produce post-inflammatory hyperpigmentation, or we didn't want to have any overheating procedures. So my idea was to use super long pulse Wendiag laser, smooth wand inside the mouth, and because I want to have lightening of lips and a little bit of enhancement, I use fractional area. And you can see the parameters I used, starting with piano. It was very important to use intraoral and extraoral and nasolabial super long pass Wendiag laser because of penetration, because of heating phenomena we have inside the skin, and because of anti-inflammatory Wendiag laser work. After that, I use Ergen Smooth intraoral and then lip resurfacing
with fractional area. This is another interesting case. This lady was over 40s, and she wanted to have treatment of acne scars. She had more than 20 years, and her decision was not to use anything which will produce any downtime, to produce peeling, crusting, and to be painful. So my idea was to use non-ablative anti-acne laser. And because it was non-ablative laser, we needed to have a lot of treatments. And these pictures are made before and 8 months after 7 laser sessions, 4 weeks in between, and follow-up was 4 months after the last session. So you can see the parameters here. Pulse duration was 0.6 milliseconds, fluency 30 joules per square centimeter, and very high number of passes 10. Great results with non-ablative laser. This is another interesting case of acne scars. This lady was younger than lady before when we started the treatment, and she had history of fractional CO2 laser treatment without great success, let's say. So my idea was to use fractional Q-switch laser, and you can see that we use parameters which are producing pinpoint bleeding as a result of finishing treatment on one area, and you can see nice results after the treatment. It is very important to understand that you need to have pinpoint bleeding during the treatment, because this is the sign that we are deep inside papillary dermis. We have had only 2 laser passes. I used 11 millijoules per pixel. It was MAQ-X2 Starwalker platform, and as you can see here, 4 months later, 2 laser sessions, great results. Burn scars produced by inappropriate use of J plasma. The treatment was performed in cosmetic salon, and this patient came to my clinic 2 months after this inappropriate cosmetic treatment. So we were dealing with burn scars. I was using combination of short pulse and YAG laser in the Nanos platform and erbium YAG fractional laser treatment with FS01 handpiece, because I wanted to resurface the whole area. And with YAG laser, we perform laser treatment of small vascular loops we have in the scarring area. And much more important is that we had early laser treatment. And this is our last case for this presentation. It was a young man with acne conglobata and scars on the facial area. When he came to my clinic, we had a problem to apply standard drug therapy because of his underlying allergy. And I decided to use in the same session anti-inflammatory short pulse and YAG laser, different parameters to different parts of the facial area, because some of them are hairy, some of them are very light and thin. And after that, we use fractional erbium laser FS01 handpiece for resurfacing. So we had 12 number of anti-YAG laser sessions and only 2 fractional erbium YAG laser sessions for final result. Long follow-up is essential. So thank you for listening to me today.
The results of a Glamour magazine survey conducted at the end of the 20th century shows that more than half of women said, "If my hair looks good, I look attractive no matter what I'm wearing or how I look otherwise." In another study, women say, "If my hair isn't right, nothing else can make me feel that I look good." Female pattern hair loss has emerged as a preferred term for androgenetic alopecia in women, due to the uncertain relationship between androgens and this entity. Initial symptoms may develop during the teenage years and lead to progressive hair loss with a characteristic pattern distribution. More than 21 million women in the United States alone experience female pattern hair loss, and it's not surprising that hair loss in women can be a serious cause of psychological stress and morbidity. In one study, 55% of affected women displayed symptoms of depression. The effects of alopecia, however, reach far beyond symptoms of depression and include anxiety, obsessions, dissatisfaction with one's appearance, and low self-esteem. In that same study group, 89% of women experienced an improvement of those symptoms after treatment for hair loss. And since female pattern hair loss is ongoing for many years, a long-term approach is needed. We present a case report of a 72-year-old female patient with confirmed long-standing female pattern hair loss. Minoxidil and cypertolone acetate were unable to stabilize her hair loss and thinning. Before the laser treatment, the patient's hair loss was assessed as grade 2 by Ludwig classification. Trichoscopy confirms miniaturization of hair shafts and vellus hairs. Erbium-YAG laser was proposed as an alternative compatible with patients' demands. The results were assessed by the subjective hair growth assessment scale, the standardized 7-point evaluation scale, trichoscopy, and fully automated measurement and calculation assessments. The patient was subjected to 6 treatments with Erbium-YAG laser at 2-week intervals. We used Fotona SP Dynamis in smooth mode pulse. Energy of 2 joules per square centimeter, frequency of 1.6 Hz with a full beam R11 handpiece. No laser-related side effects nor pain developed during or after the treatment. A follow-up visit took place 8 months after the first treatment. Our patient reported raised self-esteem and improved social activities. She was satisfied with the results obtained. Hair loss was stopped and the patient experienced increased density. The patient's subjective hair growth assessment scale revealed a 26 to 50% improvement. 7-point evaluation scale was comparable with a moderate increase. Trichoscopic measurements showed increased total hair count in both frontal and crown areas, increased number of terminal hairs, and decreased vellus-like hairs. Mean hair density returns to normal. Female pattern hair loss is a very common hair problem with a significant emotional impact. The pharmacological treatment options are limited. Minoxidil and cypertolone acetate did not result in disease stabilization in this patient. Laser therapy seems to be effective and safe in the treatment of hair loss. Laser could significantly promote hair growth through upregulating the WNT and beta-catenin pathway, amongst other laser-induced mechanisms. Non-ablative Erbium-YAG laser is promoted as a novel treatment option for pattern hair loss. Growth of new hair is noted in recent studies. In this case report, treatment with non-ablative Erbium-YAG laser resulted in increased hair growth and stabilization of hair loss. No adverse event was reported. Our patient was satisfied with the results. The treatment is safe, convenient, and leads to increased growth of new terminal hairs, even in long-standing pronounced disease.
The Laser and Health Academy, LA&HA, is dedicated to the promotion of research, education, and publishing in the field of laser medicine. LA&HA, since its inception, has already become a coordinator of the EU Regional Competency Center for Biomechanical Engineering, connecting several industrial and academic research partners. Moreover, LA&HA is also a member and a coordinator of the EU technology platform Fotonica 21. Since establishing LA&HA, we have already achieved so much, and in this process accumulated a wealth of knowledge, experience, and created a wide-spanning network connecting educators, researchers, and doctors alike, providing them with a platform for the exchange of knowledge, ideas, and research opportunities. But with all of this, what is the next step? Where are we going? In the last year, I announced to you a new LA&HA experience is about to happen. And I'm very pleased to say that we've been working tirelessly to make this happen. We've taken the best of what LA&HA was and built upon this excellent foundation to create an even better experience. LA&HA Academy, research, education, library, and publishing represent all of the key elements that are further improved to offer a unique solution, and these segments intertwined between each other fully represent the vast scope of LA&HA operations. And I'm going to show you but a sneak preview into the new LA&HA webpage that will showcase our progress. As an integral part, LA&HA Academy, with its affiliations to several academic institutions, a state-of-the-art facilities, and countless world-class lecturers, is expanding through a network of LA&HA centers globally to offer the new and exciting opportunities. LA&HA Academy is the backbone of our development, and in the new LA&HA webpage, our world-class lecturers specifically will get their own profile page, and you will be able to connect with them and their work more easily. The research subsection will showcase new and exciting research opportunities, projects, and groups with new researcher recruitment readily available. We're also expanding on our educational program with a variety of courses ranging from online training courses, workshops, and the LA&HA Master Program that is available already today. We are expanding also a new fellowship program that will engage a broader field of participants and enhance their knowledge on a selected field. The foundation of our knowledge is, of course, our comprehensive library that is constantly growing and has already become the ideal resource for evidence-based content, be it in the form of video lectures, journal entries, or clinical notes or articles. Most importantly, a universal search through our entire categorized library will be available by a click of a button. As an extra feature, this search function will also be available in your local language to facilitate an easier and more fluent search experience. And lastly, LA&HA is also a publishing organization with our own international peer-reviewed journal that we are making even more accessible to potential researchers and offer to them a platform for new and exciting opportunities. With our overview on our publishing activities, readily available publication submissions, we are further improving on our already internationally accepted peer-reviewed journal. And lastly, when first asked where we are going, well, the answer is simple. We are going to create an even better global network for quality education, research, and publishing for the promotion of evidence-based laser and energy-based medicine. For now, thank you for your attention.
Unfortunately, we have come to the end of this year's LA&HA Symposium Aesthetic and Dermatology program. I would like to thank our guests and all the doctors for sharing with us these amazing presentations and opinions, and for contributing to the continuous growth of knowledge among the Fotona community. We believe that all of this knowledge will be a great source of information and inspiration to Fotona users globally who are eager to improve their results and understanding of this continuously evolving technology. I hope to see you next year face-to-face in our beautiful Slovenia. Till then, I wish you all the best and that you stay well and healthy.
I couldn't find one that could even replace or come close to the Fotona. It's really my bread and butter machine because I use it every day, non-stop.
Using a Fotona laser is like driving a Lamborghini. And I often use that analogy to them because once you've had a Fotona laser, you really can't go back to using anything else. It really is the best system.
Fotona makes things that nobody else makes in the entire world.
Technology is a must, and Fotona is the master of technology in lasers.
I'm moving ahead of my practice, and I feel always with Fotona that I'm ahead of any competitors.
We choose Fotona, and right now we are really convinced that Fotona is the best laser brand in the world.
Our profits grows by at least 50% year-on-year basis since we acquired our Fotona system. We are very proud of what we have achieved, and more importantly, we are extremely thankful to Fotona.
The versatility of the machine is incredible. With Fotona, I keep learning something new every year, which is fantastic.
With SP Dynamis and Star Walker, all my required wavelengths are taken care of.
The machine is like a full laser center.
The main thing I wanted, I was told that it's built like a German tank. And so I need something that is very robust.
And I can tell you, after many, many years of experience and many different kind of a system I try in my clinic, Fotona, every time I get a Fotona in my hands, I feel safe.
I love the machine, absolutely brilliant workhorse, and has made my business what it is today.
We have to say that our lasers are in function almost all day, every days of the week. So it's a huge part of our practice and our clinic.
And you can see now, we can do nose, we can do eyes from the both sides. Nobody, no competitors. And this is the best point to advertise. You don't have laser like that around the world.
Nowadays, SP Dynamics represents the 80% of my revenue in my daily practice. So I'm completely satisfied with the results I'm getting with my SP Dynamics. The laser that by far my patients love.
I think the efficiency, the effect, the quality of the treatments is helps my practice a lot.
We do 10 to 12 to 15 patients a day, every single day, 7 days a week. And I've had it for almost 2 years, and so far so good.
Being able to get into my clinic as number 15th and 16th laser is quite an achievement for Fotona.
Fotona was an easy decision because of the resources that it offered.
They've got a fantastic website where you can just go in and watch the videos and learn from them.
We've not only got the best system, but I love that Fotona offers so many different learning opportunities. So things like the LA&HA conference and being able to learn and support and encourage other users to be the best that we can be.
Not a day goes by where I do not feel extremely proud to be part of the Fotona family, where users around the world are connected in such a close-knit manner.
So I chose the Fotona and I'm very, very happy with it.
Since the development of its first laser over 50 years ago, Fotona has continuously played an important role in the global development and advancement of laser technology. This experience justifies Fotona's commitment to deliver to medical professionals the highest performance, best-made laser systems in the world. Using a science-based approach and working closely with top universities and medical research centers enables Fotona to introduce new pioneering solutions that provide superior results in aesthetic medicine. Fotona's range of high-performance aesthetic systems is impressive. Fotona's Dynamis Pro multi-application laser represents Fotona's most versatile multi-use laser platform, offering over 100 different applications in aesthetics, surgery, and gynecology. Equipped with both 1064 Nd:YAG and 2940 erbium YAG laser and having multiple proprietary modalities of energy packing for each wavelength, this high-performance laser system is able to replace up to 10 different energy-based devices. Dynamics' proprietary VSP technology enables exceptional versatility in depth and heat deposition. For example, the Fotona Smooth erbium laser treatment modalities provides for gentle regenerative heat shock heating of the superficial skin layers, and the ultra-long Fotona Piano neodymium laser modality enables deep skin heating while keeping the epidermis safe and comfortable. Additionally, the ultra-short Fotona Frec-3 modality can be used for a three-dimensional fractional targeting of skin imperfections. The Dynamics comes with procedure-specific applicators, including advanced robotic scanning applicators for ultimate speed, safety, and efficacy when treating large skin areas. Among the most popular Dynamics treatments are Fotona 4D for multidimensional facial rejuvenation and tight sculpting for skin tightening and fat reduction, in addition to the core aesthetic treatments of veins and vascular lesions, removal of scars and benign lesions, hair removal, and more. There are also many new emerging applications, such as hair restart to stimulate hair growth and vector lift for non-surgical facelifting that additionally complete the Dynamics' comprehensive and growing treatment portfolio. Fotona's next-generation erbium YAG and Nd:YAG aesthetic laser dedicated to facial aesthetic treatments is known as Time Walker Fotona 4D. With a unique combination of advanced laser technology and proprietary ASP power treatment modes, Time Walker is designed and optimized for non-invasive facial procedures such as Fotona 4D, Smooth Eye, and Lip Lace, using a combination of superficially absorbed erbium laser and deeper penetrating neodymium laser wavelengths. Fotona's Starwalker MachWix Q-switch laser system is at the top of its class owing to its extremely high energy output and widest range of pulse modalities and applicators, enabling widest possible range of Q-switch applications not only for pigment but also for vascular treatments. Starwalker's high energy, 4 wavelengths and proprietary FRECTAT capability make the system a leading tattoo removal solution. Starwalker MachWix is capable of delivering an unprecedented 10 joules of Q-switch energy in one giant, structured MachWix pulse for treating tattoos, as well as epidermal and dermal pigmented lesions, and also includes additional long pulse Versa-free, infrared, and Verde green modes for enhanced vascular treatments, hair removal, and other procedures. Unique fractional handpieces enable non-ablative fractional photorejuvenation as well as FRECTAT ablative procedures for more effective tattoo removal, rejuvenation, and scar treatments. Fotona's Starwalker PQX represents another example of Fotona's highest performance philosophy. Ultra high energy output, extremely short picosecond pulses, and maximum peak powers are just a few of the characteristics that make Starwalker PQX a superior aesthetic device. Every piece of this laser is outstanding, from its core optical technology to the excellent design of its GUI and handpieces. And all of this in a device with the smallest footprint enabled by the Fotona's proprietary technology. With additionally wide range of aesthetic wavelengths, the Starwalker PQX is ideal for treating pigmentation disorders, skin whitening and toning, from black to colored tattoos, and more. The system's advanced technology is suitable for both first-time users and advanced practitioners, providing an intuitive user interface with preset treatment parameters and integrated history of past treatments and patient database. The newest addition to Fotona's aesthetic line is Starformer, a high-intensity Tesla magnetic stimulation (HITS) device enabling muscles to strengthen, tone, and firm without effort. The Starformer tight wave treatment uses non-invasive HITS technology to selectively target muscle tissue and providing strengthening, toning and firming of specific areas of the body such as the glutes, abdomen, arms and back. Starformer offers safe, quick and easy muscle strengthening in a non-invasive manner with a high success rate and exceptional patient satisfaction. Fotona continues to deliver to the medical professionals and patients most advanced and innovative devices, in line with its commitment to engineer the highest performance, best-made medical systems in the world.